Namaste, welcome to all of you. Myself Jyoti, Assistant Secretary, CBSE Department of Skill Education. I am honored to welcome you all to this capacity building program that embodies our commitment to continuous learning and growth. Over the course of today's session, we will embark on a journey aimed at equipping ourselves with the knowledge and skills. Now, let me welcome Pyali ma'am. Pyali ma'am is a PGT biology in St. Peter High School, Sikandrabad. Welcome, Pyali ma'am.
Thank you, ma'am. Yes, ma'am.
Hmm. And now let me introduce so eminent resource person are Manoranjani ma'am. Manoranjani ma'am is a vice principal in Amrita Vidyalayam, Kochi. Welcome, Manoranjani ma'am.
Thank
We
you,
are
ma'am.
so honored to have you
Principal,
as
ma'am.
a
I am
person.
the principal of Amrita Vidyalaya.
Sorry, ma'am. Earlier, I had this profile, and I'm extremely sorry. Ma'am is principal now, Amrita Vidyalam, Kochi. Welcome, ma'am.
Thank you, ma'am.
So, Pyali ma'am, Manoranjani ma'am, can you tell me about something healthcare? What is healthcare? What is the scope about the taking this subject for the
Uh,
students?
Ma'am, healthcare is the subject. This is the one basic course in the skill education. So, where the students will get the exposure basically to work in hospital after doing the course, and the subject gives them a vast and wide knowledge about the traditional and the contemporary, like whatever aspects of the healthcare it is going on in our India right now, and the input of the basic fundamentals, then the coupled with the practical knowledge also. So that is the basic course overview here basically. And the objective of the course, that is the in this course basically, the main objective that we follow, the to train the paramedical staff are the that is the main objective, how to train the paramedical staff to understand the effective communication, identification of the hazard, and then their management if any disaster happens in our daily life, how to manage with them, to understand the rules and regulation what are getting followed in the different aspects of the hospital, and basically to understand the clinical duties what in the means in the hospital, from the staff means the doctor, starting from the doctor to all the staff who are working in the hospital, what are their clinical duties we will understand, and to understand about the administrative duty also. So all kind of information regarding the hospital and that environment we are going to share in this session.
Sure, Pyali ma'am. What I think that this subject, one of the subject which serves mankind.
Yes, ma'am.
Manoranjani ma'am,
Yes, ma'am.
I
Health subject, actually, it's a very important subject. Health is wealth. So the health and wellness. So we need to see that people must be having a minimum understanding how we work in the hospital and how we care for the life of the people in the hospital. And more than that, by having this particular subject even after class 12, and there is employability, I think, for this subject, and people may get a job in the hospital, maybe in the front office or even some other very important post in the hospital, and with that they can go for higher studies also. So as a person, even otherwise also job opportunity is there. More than that, I think we get a general understanding regarding how the hospital function and how people take care of life of the people in the hospital. So that is the main highlight. And more than that, employability is the another area where we can see that it is easy to get a job and let the people be responsible for others life and other skills. And even the people are getting very important skills like self awareness, and then social skills, and then intelligent thinking skill also will improve by studying this particular subject.
I am having a query to both of the resource person. Like in nursing, maximum we do see female there, but in when we think about the doctor and later on, I think MD something like that. Both genders are there, but in nursing we do usually see females. How can we promote so that more male students will join this subject?
Ma'am, actually, it is a traditional concept कि only the female can work as a nurse. But nowadays, the concept has been changed completely. Now they are called as the general duty assistant. So in the field of general duty assistant, that is not like only the female can work in that. They are male and female, both are means welcome to work as the general duty assistant. And general duty assistant, if you see, my means in the healthcare subject also, where the roles and responsibilities of the general duty assistant when our students will be learning, so their nursing is only as a part of the general duty assistant. So male and female both can come in this field. It is not only for the female, because it was a traditional approach. But right now you only tell me, when one male person are getting admitted in the hospital, maybe that male person is not feeling comfortable when any female nurse is coming and doing for them. Or that's why the traditional concept is like that, ki nurse is always like our mother or sister. We have made this concept. But in the place of any female staff, if any male staff can approach the male person, I think that person will feel more comfortable, that patient will feel more comfortable. So actually by learning this subject, our means when the males means the students, like it is not gender biasness should be there actually. So as a, we will tell them as general duty assistants, so male and female both can be working in this context.
Manoranjini ma'am, I have seen a movie where a male person was a nurse and he was all the audience were laughing at him that तू nurse है. So how we can remove this stigma?
Yes, ma'am. It is beyond gender and sex actually. And here that's why the children they study about the skills. Those who have empathy, they can be there here, and those who are responsible person, irrespective of whether they know he or she, and the person who has empathy and who has self-awareness, who can take care of others and who can manage the stress, that person can be here in this field actually. I think male people will surely enjoy being in this field because they never feel that it is the job of a lady. It is irrespective of this male or female. I think the work dedication is more important here.
It is, I think, as a service to mankind, which is
Yes,
not
ma'am.
a gender biased.
Yes, ma'am.
So we should promote and to the all teachers who are watching our session, it is my request to motivate all the students which who all are in touch with you. If they are interested, just motivate them to opt this subject and further career. So I think we should start with our formal sessions. So over to you, Pyali ma'am and Manoranjini ma'am. Thank you so much for providing the whole information, and we are looking forward more and more enlightenments by you. Thank you so much. Over to you.
Oh, thank you so much, ma'am. Thank you for the opportunity. Yes. So now we are going to start our session based on the healthcare subject. Healthcare is the subject that is introduced by CBSE as the skill subject in grade 9 and 10 also, and grade 11 and 12 also. Grade 9 and 10, the subject code is 413, and grade 11 and 12, the subject code is 813. So these subject grade 9 and 10, the only the approach is given ki the students can understand the basics, whatever the basic things we can take in our life, in our healthcare field, just to protect ourselves. Okay, like any, suppose simple fast aid, if we get a simple cut, so how to deal with that situation? If any person gets a simple dog bite, so how to deal with that situation? So like these kind of simple things, in grade 9 it is introduced. Grade 10 it is quietly deep, it is given like what are the roles and responsibilities of the general duty assistant they are having, and then how to what are the different human body structure and organ functions, and then the next one in like disaster management, emergency care, how we can deal with. Grade 11 when we are coming, the course is getting quite vast, and it is completely like now the students will get the knowledge to get the knowledge about how in the hospital the people are working. And grade 12 the course will be over, the whole 4 year course, it is 9 to 12 if the students opt for. So grade 12 the students will be able to get the all theoretical and practical knowledge based on the healthcare subject, where they will learn about all aspects of the hospital field. So now I will be sharing my screen so that I can discuss about the subject in detailed way. I think my screen is visible.
Yes, ma'am.
Yes, ma'am. Okay. Okay, so today in the first session, basically we are going to start with the healthcare subject, the overview of the subject. What are the objective of the course, the salient features, what are the different materials we need in our school when we are opting for this subject for the students, and what kind of practicals we can do in the school when the subject will be, we will register for this subject and the students will be working, and materials required, and after that basically what are the different career opportunities, because whenever our students will come to our school as to opt for the subject, definitely we have to tell them about the career opportunities. Just now what Jyoti ma'am shared with us, like means because career opportunities is very very important in today's field, because whenever the students are coming in our school, they all are very much career oriented. So already our traditional thinking is like that ki, whenever we are working in hospital we should be doctor, but it is not at all a means complete thing. Yes, doctors are obviously important thing, but do you think that the doctors can only work without the help of any other people who are working in hospital? No, it is not at all possible. The doctors also need the help of the medical staffs, like there how much important role the doctors are playing, the same equally the important roles are played by the nurses also, who are taking care of the laundry of the patient, who are taking care of the diet of the patient, the dietitian, and who are taking care even to the sanitation part of the hospital, that is also important. So each and every role when we are learning about healthcare subject, so that time the students will get the vast knowledge कि the along with the doctor, the other staff members of the hospitals are also equally important, and their jobs are also be say as same as respectable in means how, because they are also giving the, getting the full opportunity to work in hospital. What is the vertical mobility of the subject we will discuss, then we will come to the curriculum part, and in the curriculum part we will be discussing about the whole curriculum of grade 9, 10, 11, and 12. The 9, 10 curriculum will basically be discussed on the first session of today's session, and grade 11 and 12 curriculum will basically be discussed in our second part of today's session. And we will discuss about the all practicals, what means whatever practicals part we can do in the school for our students 9 to 12. So 9 to 12, that is also very important, because we have to train our students in a way कि when they will learn all 4 years this core skill subject, they should be means they should be able to perform all the practicals what are basically happening when the means staff they are working with the patient, how they are dealing with the patient. So our students will get also the knowledge practically, so that will also, that also we are going to discuss here. So basically, what is the basic objective of the subject? Why we are taking the skill subject as the healthcare? The basic objective is to just to train the paramedical staff. We can train our students in a way so they can be working as the paramedical staff, to understand the effective communication. That is very important in the hospital field, because when anybody is dealing with the patient, so communication is very very important part. So communication our students will be learning as the part of the employability skill, also communication skill. And in the subject also communication skill is there. Identification of the hazard. If any hazard is happening in our nearby area, so fast we have to identify the hazard. Suppose we are walking through the road right now, you can see in many places of India, they are that places are facing too many heat waves, and the people are facing so much problem, dehydration problem. If any person is getting a sudden heat stroke, so how to deal with the situation? We have to know that we, if we can train our students on that manner, and on the way when our students are passing, if any person is facing any simple problem like the heat stroke, how to deal with the situation, so our students will be able to save a life. So that is the main motive. Suppose any small cut we got, where we get in our means hand or leg, wherever in the house, our students know how to do the first aid treatment, and then and there the treatment will be given, so we can save the life. Just because we can prevent the blood loss. So this is the most important thing, the objective of the course, to understand the rules and regulations of the hospital, and just to understand the clinical duties. Here we can see like when how to measure the blood pressure, how to measure the pulse rate, then how to measure the BMI, how to perform the CPR. So these are the basic things are needed in our everyday life. So these clinical duties our students will learn, and to understand the administrative duties also, because it is not only the healthcare staff, the doctors, nurses they are doing, but administrative parts are also very very important. How the receptionist is doing their work perfectly, so that is also important thing. How the OPD, in the OPD outpatient department, how the procedure is going on, how to take the appointment with any doctor, who is helping us in that, how the when one patient has to be admitted in the hospital, so how the inpatient take inpatient care we can take care. So all the aspect is that is the we will teach our students, so that our students can be eligible, or our students can understand the whole working of the hospital. Now the different salient features. Before that, I want to show you one video. So that is one touching it's very touching video, you all can see it here. Because we whenever Manoranjani ma'am has also shared that ki, whenever we have to work in hospital, we should have the empathy. It is very very important. We have to understand the situation of the patient, and we the patient and their family, their attendant member also. So that video you please go through it. So, by this video, what we have seen, what is the basic thing we have to implement in our students? That is the first thing in the healthcare field is empathy. If our students, when they have to go to the hospital and they have to work with the patient, they have to know how to do the mind read of the patient, because what they are thinking, that is very very important in this field. So that is the thing. In the whole session we will do so many activities, means we will see what are the activities we can do, and we will see what are the different practicals we can do for our students to inbuild these empathy in their life. And this empathy, when we as a teacher we can inbuild the empathy in our students, it will not only be helpful for them to work in the hospital, but in their personal life also it will be beneficial, because empathy is needed for each and every person to be lovable to all over the world. So that is the basic thing we are starting with. Thank you. Now the next one, we are coming to the core subject, the basic salient features what already we have discussed, the training the paramedical staff. Our paramedical staffs are working in different areas of the hospital. So means how they work, means starting from the sanitation, that work goes up to the doctor, how they are working, and the how the sanitation, laundry part, diet part, nursing part, how they are working as. So that is the paramedical staff work we are going to learn. Effective communication skill, when we communicate with any person in the hospital, we should be empathetical to or sympathetical when we are talking with any other people. So communication skill is very very important in this context. Identification of hazard, when there is any kind of emergency situation, how to deal with the situation, that is another feature of the course. Management of hazard, how much hazardous it is, the situation is, we have to do the risk management. So our students should know, suppose one small thing, if the person will be very much panicked on that situation, so in the hospital the full chaos will be created. And there are so many ill persons are there, maybe they, some people are terminally ill, some people are means so much ill ki they cannot walk also. And because of the panic there can be a disastrous situation in the hospital. So management of hazards and risk management is also very very important in the context of the healthcare field. Follow the rules and regulation. So any rules and regulation when it is given in any hospital, always we should take care of that. We should not break the rules and regulation. We have to train our students in a way कि they will always be able to abide the rules and regulation. So first we will start from our the school rule. What are the rules and regulation of our school? If we will train our students in a way कि whatever rules and regulation they are getting in their personal and professional life, so they will abide by them. Because one simple break can become the disaster for any other person life in the hospital. So that's why we have to train our students in a manner. Recording the vital parameters, it is very important. We have to train our students in a way so that they will be able to they will be able to do the like blood pressure measurement. Then the next one is the pulse rate measurement, how to measure the pulse rate, how to measure the blood pressure, and how to measure the temperature. So these kind of, see, this we will be doing in the practical, basically practical part. We will train our students in the practical part so that our students will be able to do it at their personal life also. If somebody is facing uneasiness at their home, so at in their neighborhood, so then and there they will call our students ki please come and help us. So our students can go forward and move forward, and in any emergency situation the basic thing, the basic need, they also can do. Not this will not only be the part of the hospital, but in our daily life also it will be very very applicable. Next one, preparation for the patient. When as a general duty assistant, our students will be preparing any patient. They have to be very very patient, very very patience level they have to maintain in their life, because they are working there. Our students, when they will be working as the paramedical staff in the hospital from morning to evening, evening to night, 24-hour shift. So they have to be trained in a way that they can deal with all the need of the patient. That is very very important. And medical history and medical prescription and medical documentation, this is very very important part in the hospital. Because some people, some patient, when they are coming to the hospital, maybe they are bringing their previous reports. When they are getting all the treatment and diagnosis procedure whatever happening in their hospital, so when they will leave the hospital, all the records should be kept very nicely in the hospital, so that in future purpose, if the patient will come back and ask for their previous document, so the hospital should provide that. So we should not think ki, okay, the patient has taken the patient is released from the hospital, so we can destroy all of their records. No, in the hospital there is a specific protocol. They keep the records for future uses also. So how to preserve that, our students will come to know. We will teach our students, so in their life also they have to be very very careful of the important matter. We have to train them. We can train them from very early age, like when they are in grade 9. We have to teach them how to maintain our valuable things, how to take care of our valuable things. So when they will come to their adulthood and they will enter in the hospital, so they will be able to means take care of the all the medical history of the patient, medical prescriptions, and the medical documentation. Scheduling the appointment is very important. Whenever suppose any of our student in future, the person will be working in the hospital reception. Okay, any patient or any attendant of the patient has called for any doctor's appointment, but at the time if that need will not be taken very seriously, and maybe any problem will occur and the appointment will not be given, that can be life threatening for the patient. So we have to make our student in a way so that they will understand each and every situation of the hospital, each and every situation of the patient. At least the patient will be completely new for them, but our students have to be very very empathetical so that they can understand the situation of the unknown people also. That is very very important. So scheduling appointment is also very very important in the hospital field. Maintaining rapport between the patient and hospital, that is very important, because in a hospital, when any patient is coming for getting the treatment, the what the patient will expect, the patient will expect the empathy, because already the patient is in very much pain, the patient is unwell, the patient is not able to walk properly, talk properly, eat properly, so many medical complications are happening. So that time our staff should be very very kind to them. That is kindness, very important skill. Our students should grow in them, so that they can make a good rapport in between the patient and the hospital. It is very very important, because means you people only think that whenever we go to hospital, so what we think, like if any hospital staff is talking to us very rudely, really do we like that? No, we don't like that. We feel so much uncomfortable. If any problem, by the time if as a patient I am facing any problem, and if the staff is talking to me very rudely, so I will not be able to tell whatever problem I am facing. So maybe as a patient, when I am not able to tell my problem to the staff, so the staff will not tell to the doctor कि whatever symptoms I am facing, so the doctor will not understand कि the as a patient whatever problem I am having, so my diagnosis procedure can be wrong, and if my diagnosis procedure can be wrong, my treatment procedure also can be wrong. So we have to train our students to be very very kind, so that when the our student will play the role in the hospital, the patient should feel comfortable with our students, so that they can share all of their problems with them, with the staff of the hospital, so that in the right way the staff can give the symptom, tell the symptoms of the patient to the doctor, the diagnosis procedure will be in the right way, and the treatment procedure will be in the right way. So in this way we can give the better treatment for the patient, and we can do the right way, we can make the treatment procedure in the right way. The rapport, in the rapport it is very important. Sometimes as a patient, when we are also going to the hospital, we don't understand what the doctor has written in our prescription. Many people we are present here, we don't even understand what is the disease I am having. When we look at the prescription, we don't understand. So that time means whatever the doctor medical terminology the doctors are using, sometimes we are unaware about that. So we have to be very very careful on that. Ki means as a GDA, as a general duty assistant, when we are working in the hospital, so that time we have to explain everything to our patient. It is very very important, so that the patient can understand ki how much ill the patient is, what are the different support the patient need, what the actual disease the patient is suffering from. And it is very important not only for the patient, but also for the attendant of the patient also, the family members of the patient also. What are the different diet the family member can give to the patient when the patient is going to home. It is very important. So because sometimes the doctors are giving the diet chart, but after coming home we don't at all follow that, but maybe the whole treatment procedure is there in the diet chart only. Simple one example, if anybody is suffering from diabetes, so that time maybe that person has got any fever, So the when the person is in the hospital, the patient is in the hospital, what the doctor is doing, the doctor is doing giving them the all medications, and the treatment procedure is done. By the time when the doctor came to know that the patient is suffering from simple diabetes disease, so the all the food which will be provided to the patient, so that will be sugar free and that will be carbohydrate free basically. Okay, the only limited amount of carbohydrate will be provided. So when that patient is coming home and doctor is telling the family members ki the patient should not consume lots amount of carbohydrate, so the family members sometimes they are unaware about that. So what when they are coming home, if they give lots of carbohydrate to that specific patient, but unwillingly, what is going to happen, the health of the patient is going to deteriorate. So as a medical staff, as a general duty assistant, we can make the family member aware about the situation of the patient. So whatever the extra work we have to do for the sake of our patient, for the betterment of our patient, as a healthcare provider we can do that. So we have to train our students in a way that they will be able to manage all kinds of situation or related to patient, related to patients family members, related to doctors, means they will be like a bridge. They will be like the bridge, so that in between the hospital and the patient, the rapport will be maintained in proper way. They have to be very very empathetic, very very sympathetic in this manner. Now next one, what are the different list of materials required for our healthcare? The list of materials that is basically required for our healthcare when we are going to opt for the subject in our school. What are the different things we should have in our school? That is the basic thing. It is not key, not at all like that key in our school we have to set up a whole hospital. No, it is not at all possible that in our school we are going to set up the actually what is happening in the hospital. We can't do that. So in which way we can train our student? The first way, some basic thing, one simple room. I think many schools are having the sick room. In the sick room, when any patient means in the school only, whenever any child is not feeling well, the child is coming. So the some schools they are having the nurses also in the school to take care of the sick room. So when the child is coming to the sick room, so the means we can train our student, our 9 to 12 healthcare students, to motivate those means the child who is coming for the treatment, or the child is coming to the sick room for that because the child is not feeling well. So our students can give some kind of like blood pressure measurement. They can help the nurse to do that present in the school, or they can just then and there they can give some first aid treatment. Suppose the means one game is going on, any of the student has fall down on the field, so the student has got a deep cut. So when the child will be taken to the sick room, our healthcare students can provide the basic first aid for them. So that kind of similar simple thing we can implement in our school also. That will not be beneficial only for the students of 9 to 12 students, but I think so that for the school itself it will be very very beneficial, because in our school only we are training the students to do all kind of first aid treatment. So what is the normal basic thing we can keep in our school in the sick room? Basically sphygmomanometer. Sphygmomanometer is one kind of machine which is helpful to measure the blood pressure, and we can train our students to measure the blood pressure also. Sometime in our school we have seen, right now our teachers are also facing so many stress in their life. So when they are facing the stress in their life, so basically when they are facing the stress in their life, what is basically happening, when they are facing the stress, then what they are happening, they are also coming to the sick room, basically means our teachers also. So then and there measuring of the blood pressure is very very important. Measurement of blood pressure is also very very important, because if our student will see the teacher is having high blood pressure, so from the school side, then and there we can send the teacher to the hospital. So but if we can't know how to, if we don't know how to measure the blood pressure, and immediate action will not be taken, so our there will be means more risk for that specific human being. So that is the basic thing we can keep in our hospital. Next one is the thermometer. Thermometer is very important. Suppose any child or any teacher, they are getting the high temperature, but when we touch the person, can we really understand how much temperature the patient is having? No, we can't understand. So what we need the thermometer just to find out what is the actual temperature the patient is having, the person is having. So how to use the thermometer? There are different types of thermometer. It is there inside the code. So how to use the different kinds of thermometer? In the different areas of our body part, we can use the thermometer. Sometime under the tongue we can use, sometime under the arm we can use, so sometime only on the forehead also we can use the thermometer. So in which situation what kind of thermometer we can use, we have to train our students on that basis. Next one, the measurement of height and weight. That is very, very important. Measurement of height and weight. Because when we know the height and weight of any person, then only we can measure the BMI. And BMI level is very, very important. BMI, why the BMI level is important for all children? Because the part that child is going to be obese or not in future. Just by measuring the BMI level, we can find out. Okay, so and the proper growth is happening for the child or not, that is also important. If one simple wall mounted stadiometer and one weighing scale we can keep in our sick room or in our laboratory, healthcare laboratory. So for the whole school, starting from the kindergarten like the pp1 pp2 nursery kid and up to grade 12 kid, like we can measure the height and weight for the whole school children. So when we can measure their height and weight, we can find out what are their BMI level. So that time it will be really helpful, not only for the healthcare student, but also for the all the children of the schools, all the students of the school, and it will be helpful for the parents of the students also. Because if we see that any person in any child is going to be obese, so that child can have more problem in future, they can get many diseases. So we can make some awareness program in our school also. Based on that, we can call the parents and talk to them also, that our children means any problem if we are facing in the children. So that's why these are the different list of material we can keep. The last one, that is the first aid kit. That is very important. First aid kit, we already know, in many of us we are keeping the first aid kit in our house also. But what are the actual material we are keeping inside the first aid kit? We are going to teach our students in details. In details we are going to teach it. What are the different materials we are keeping in the first aid kit? In our house, when we are making the first aid kit, we are keeping the very means normal things. But in basically, if you see a real first aid kit, it contains lots of things. And the first aid kit is not only helpful to give the like first aid treatment for only cut. Many other situations are also there in our life where the first aid kit can be helpful. So these are the different list of materials, means what we can keep. That is all the list. If you see, this is not at all very much heavy things that we cannot keep in our school laboratory. These are simple things that easily we can keep in our school laboratory, and we can train our students in that manner. Now coming to the next part, that is the career opportunities. As a teacher, when after grade 8 one student will be coming to you, as a teacher, how can you motivate the student to take the course? So because the first one, the student will ask you, ma'am or sir, what career opportunity we are going to get if we will learn the subject. That nowadays, as a teacher, we are seeing each and every student, each and every parent, whenever they are coming to opt for any subject. So the first question they ask that only, what is the career opportunities? Because everybody have to set their own career. The first one, that is the BSc nursing. The BSc nursing is the first thing, means as the but Raja, what Jyoti ma'am was telling in the morning session, he only the female can be the nurse or the male also can be the nurse. It is not at all a gender bias thing. He only the female can be the nurse. Till now, actually, it is a traditional approach. We used to think that the female only can be the nurse. So that's why we used to say the nurses are like our mother or sister. But nowadays, there are lots of opportunity as the GDA. We call it as General Duty Assistant. After learning the course, our students can do the Bachelor of Vocational degree, that is the Bachelor of Vocational, and it can be done. These course can be offered in the hospital management also, hospital sterilization program also, medical laboratory technology also, in the radiology and imaging technology also, in the operation theater technology also, in the medical record and technology also, in dialysis technology. Basically, dialysis technology is given for the kidney patients. Whenever any person is suffering from the kidney disease, the patient has to go to hospital to go through the process of the dialysis, where the blood of the patient will be purified outside the body and it will be sent back inside the body. The process is very very painful process. So dialysis technology is one kind of technological procedure. After doing the healthcare as a GDA, our patient means our students can do that. And then the cardiac care technology is also very important, because in India right now the situation is like that many people are suffering from the cardiac disease, hypertension, diabetes. So the cardiac risk is very very high in India right now. So we have to train our students in a way, we have to make our future generation in a way, so that our students can make a cardiac care technology if they will go for. Because many people, I hope, as a teacher also, we don't know in which area our students can flourish. So if we guide our students, there are lots of field in the hospital. It is not only the doctor but also the different areas are also there, like BMLT, that is the Bachelor in Medical Laboratory Technology. After that, MMLT. After that, the different courses, many courses are also there, like the radiology technician, then the pediatric technician, how to take care of the newborn baby in the hospital, how to deal with them. Doctor will come, doctor will diagnose, doctor will give the medicines, then but the whole day the doctor cannot be there. Neonatal technological care, like how when a newborn baby is means coming to the world, if the intensive care unit the baby is, that there the mother is also not allowed to stay. The doctor will come, do the treatment and go. So who will take care of that newborn baby? That is a very big field and vast field in the hospital, where our students as a healthcare, from the healthcare field, they're having their basic knowledge about the hospital ideation, so they can go and they can train up themselves in that specific cases. Cancer patient, for the cancer patient also, that specific, like the means how take the critical care. So how to take the critical care for the ill people. So when we will be our students will be dealing in that, so there are lots of scope, huge scope in India. Many hospitals, they are asking for the trained people, but they are not getting. Their job opportunities are there, but our hospitals are lagging of the people, the trained people. So we have to train our students in a way, so that we can fulfill the need of our country. We can do that by the vertical mobility. Now the difference between the care and caring, that is very very important in the context of the healthcare. So whenever as a teacher we are going to teach our student, we have to make them understand about the difference between the care and caring. What is called as care? Care means when anybody is in need, we are helping them, that is called the care, we are taking care. But what is caring? When you understand the emotion of the patient and you go to their level to help them, they will feel very very comfortable, that is called the caring. Care can be given by anyone, but caring can be given by only those people who are very very empathetic. So so what is the care, the difference between care and caring? That's very important in our context of healthcare. Like environmental health needs, health enhancements, then prevention care and wellness services, medically necessary need, basic healthcare needs. So these are the different needs. Already the needs are there, but we have to fulfill the needs. Environmental health needs, what is coming under the environmental health need? Like right now the temperature is getting very higher, so we don't know in future days what is going to happen. So when our environment is getting changed, we have to be changed on that way. We have to train our future generation to be changed in that way, so that we can meet the environmental health need. So like a few years back when the COVID-19 came, it created a terminal illness. So it was not anyone's hand. But when anybody is suffering from any terminal illness in our neighborhood, in our house, or in our society, how to deal with that situation? So we have to train our students in that manner. Health enhancement, when the population is increasing, automatically the enhancement will be increasing. The diseases, more new types of diseases will come. So how to deal with those kind of diseases? Preventive care and wellness service. Preventive care is very very important. So because when the disease is coming, so it's told that prevention is better than cure. When the disease happens, so it's very difficult to take care, but we can prevent ourselves from the disease. We have to train our students in a way that they can create the awareness in our society, so that before coming to the disease only we can prevent. So it will not only be helpful for our students, but it will be helpful for our society also. As a teacher, we can implement these kind of preventive care through our student. We can do the socialization work. As a teacher also we can do that. Then next one, medically necessary need. Whatever the medically, whenever one patient is going to hospital, the patient really doesn't know what is going to happen. If any diagnostic test the doctor is writing in the prescription, we don't even know what kind of test is going to happen. We simply go and sit and wait to watch what the other person is going to do with me. But as a healthcare provider, as a general duty assistant, they have to explain the procedure to the patient, that what they are going to do. It's very important. But in our nowadays also in the hospital, in many good hospital, you people means you also, whenever you are going, you can see they are explaining the process. But some hospital when you visit, they don't explain the process. Without explaining the process, if you tell the patient you lie down here, so there the patient will feel very much tense that what is going to happen to me. So at the time when the person is already ill and they are getting too much tension and stress in their life, just by thinking ki what is going to happen with me, the blood pressure level can increase. So this is the ways, means we have to train our students, so that when they will be working in the healthcare field, they will be working in the hospital field, they will be very very careful about explaining all the medical necessary need to the patient. And basic healthcare need in our everyday life. What are the basic, whenever we are facing, suppose we are facing any fever, so what are the different fast aid we can give? Suppose by the time the patient is having the fever, one small cotton plug, we can just dip it in the water, cold water, and we can keep it in our forehead. So whenever we are keeping it in our forehead, what is happening? It will be helpful for us to reduce our temperature level. So many people, they may not know that also. So any person, if the person is feeling the fits, at that time, means what kind of fast aid treatment we can do for the fit person. If the person is getting any kind of shock, so what kind of treatment, basic fast aid treatment we can give. Any person has got heat stroke, so what kind of basic treatment we can give for this person. So these kind of basic healthcare needs are also very very important. So now also I want to show you one video where we can understand ki what is the care and what is the caring. So we will, if we have to train our students in a way, and we can show these videos also for the motive or increase their motivation level.
facilities and palliative care for it. Near health facility, got some IV access going.
There's nothing left to say. There's just a perfect day for us to use. There's nothing else to see. No better place to be. Now that you're here with me, and I'm with you. Why don't we wait here? I just wanna stay here.
I saw a patient this morning with that name.
Why don't we
Pain
wait
starting to subside?
here? Now,
Bed management, Michelle speaking. Okay, what's the patient's name? McIntyre. All right, that's a compassionate bed. Let me see what I can do.
You guys need help? Follow this hallway down there and follow the signs to Robin's.
so please don't move an inch. Don't ever change a thing. Just let me take this in and hold it tight. Why don't we wait here? Now,
We grew up together,
why don't we wait?
and we'll die together.
I just wanna stay here. Why don't we wait here?
So this is basically the care between the, that is the difference between the care and the caring. We have see it here. Now we are going to start with the curriculum. No, before starting the curriculum, I just want to know, Manoranjani ma'am.
Yeah, yes, ma'am.
Ma'am, now we are going to start the curriculum. As the curriculum, the first part is the, means we are starting with the employability skills. So, if you want to share with the 9 and 10 grade, means employability skill now, then I can start with the main curriculum. Will it be good, or should I continue with this? What you want?
So that's up to you. And but I have problem, and you need to present it. And that's the problem at which I am facing now. So
Okay,
I
okay.
think you can continue. Then I'll
Okay.
be joining. Yeah.
Okay, ma'am. Okay, okay. So, okay. So I am going through the regular curriculum, because then after that employability skill curriculum we can discuss about. Okay, ma'am. No problem. So, as the Manoranjani ma'am will share the employability skill curriculum with you all, but now we are starting with the main curriculum of our healthcare subject. As a teacher, when we have to train our students in the healthcare subject, so basically we have to know about the curriculum very clearly, so that we can implement the course successfully in our students. So grade this is the grade 9, and I will discuss with you all with the grade 9 to 12 all the curriculum. Grade 9, the subject code is 413 413. This is 2024-25 curriculum. Here you can see the total marks will be 100. In 100 marks, the theory will be 50 marks and practical exam will be of 50 marks. So in this theory 50 marks, practical marks is 50. That also we will discuss what are the different practicals we are going to perform in the school, for the exam, how to conduct everything. But first we will discuss about the theory. In theory, basically, you can see the employability skill is the part A. Employability skill is the part A and subject specific skill is the part B. In employability skill, unit 1 communication skill, self management skill, ICT skill, entrepreneurial skill and green skill. Total 5 skills are there that Manoranjani ma'am will talk about this. And subject specific skills are basically in grade 9. It is called as the healthcare delivery system, role of patient care assistant, personal hygiene and hygiene standards, primary healthcare and emergency medical response, and immunization. So these are the subject specific skills are implemented by CBSE in grade 9. And here you can see, as the theory is 50 marks, so automatically in the theory and practical total 100 marks, you can see practical is 50 marks, theory will be 10 plus 40. So we have to give only 40 marks from the subject specific skill and 10 marks from the employability skill. So how it will be divided from communication skill 2 marks, self management skill 2 marks. This is for the final. Okay, final. And whenever, suppose in half yearly also, when you are taking any PT exam, periodic test also, if you are taking any term end exam also, if you are taking, always you have to make the paper in a way that if it is a 100 marks paper, 10 marks always should be implemented for employability skill. Or we should not only give the emphasis on the subject specific skill, but employability skill is equally important as the subject specific skills are. So always we should implement some questions from the employability skill also. Communication skill, total 5 skills are there. Each skill will carry 2 marks question, two questions, 2 marks question, so it will be 10 marks. And the subject specific skill will carry the 40 marks. So healthcare delivery system, role of patient care, personal hygiene, these 3 portion will carry 10 marks. And primary healthcare, emergency medical response and immunization, they are carrying 5 marks, total 40 marks. And we have to be stick with the number of hours also for theory and practical. For practical, in the whole year we have to spend 70 hours for the theory, for the practical. And for the theory, total 50 hours we have to spend for the employability skill, and 100 hours we have to spend for the subject specific skill. So here also the division of the number is given, how much number. So as a teacher, you can plan your annual pedagogical plan in a way so that it is what means subject here, like healthcare delivery system, total 23 hours, 23 hours as it is given. So the 23 hours means if every day also you are getting like a 1 hour class, so total 24 class you can take, 23 class or 24 class you can take to complete unit 1. Similarly 24 class you can take to complete the unit 2, like that. 23, 24, 15, 15 classes you can get to complete the primary healthcare and immunization program. So if you are getting the classes like that, if you will plan your employability skill and subject specific skill and practical or project work on that basis, so total to 220 hours you are needing, and your students will be able to give the exam on 100 marks. You can make your students ready to give the exam for 100 marks in complete 1 year. Every plan, everything is done very nicely by the CBSE, so that as a teacher we can implement it successfully in our school to give them the proper means the proper structure is already given. This is for grade at grade 10. Grade 10, as the students will be writing the board exam, so we have to be more careful on grade 10, and we have to be more strict on the number of hours and means which is given prescribed by CBSE to follow. We can do that. Here in the project and practical work, basically we are giving 60 hours, but in grade 9 we are giving 70 hours. But in grade 10 we can give the 60 hours of practical, and we can give 10 more extra hour in the theoretical part, because here theoretical part subject specific skill is quite vast. You can see it here, unit 1, hospital structure and function, introduction to care plan, sterilization and disinfection, basic first aid and emergency medical relief, structure and function of the function and the nutrition, public relation in hospital. So these are the different subject specific skills the students have to follow. As a teacher, we have to plan accordingly. Okay, here you can see the same thing we are following, like 40 marks. 40 marks we are doing for the subject specific skill, and 10 marks we are doing for the employability skill. And for the practical work we are giving the 50 marks. And for grade 10 we have to be very very careful about the project work, viva work, practical file, and demonstration of the skill competency via laboratory lab activities. So these will be the means how the 50 marks practical will be divided. The marks are given here. Like we have to make the students to do one project. So based on that project, the students can get, when they will submit their project for the final exam, they are going to get 10 marks. As a teacher, when you are taking the viva, the students are going to get 5 marks on the viva. Practical file, when they are the demonstration of the skill competency and lab activities, whatever practicals will be done in the hospital, in the school laboratory. So based on their overall 1 year performance, you can give them to based on 20 marks. And based on those practical, the students have to make one file, practical file, because all the practicals should be written in their practical file, and that file should be submitted to the teacher during the term 2 end or the year end examination. So these are the different means subject specific, means practical part C, that is the practical work, that is orientation of the marks. The teacher has to follow strictly in the practical field. And whenever you are making the question paper at your school, as a teacher, you have to follow the these kind, that these are the marks that can be provided in the different subject specific skill. Like unit 1, it will always carry 10 marks. Introduction to care plan, 5 marks. Sterilization and disinfection, 5 marks. Basic first aid, that is 10 marks. And structure and function, 5 marks. And public relation, 5 marks. So these are the different marks, and hours are also described here in the grade 10 curriculum. Now coming to grade 11 curriculum. Grade 11 curriculum is quite different from grade 9, 10 curriculum. Here the subject code is 813. That is grade 11, because they are coming to the senior secondary level. So when we are teaching the subject in the senior secondary level, there also the total marks will be 100. But in that 100 marks, you can see now there is a small change. Theory will be 60 marks and practical will be 40 marks. So in this 60 marks theory, how we are going to divide the marks? Here you can see the theory subject specific skill is converted into 50 marks, and employability skill is same like the secondary stage, 10 marks. So 10 it was 40 plus 10, 50 marks theory, 50 marks practical for grade 10. Grade 11, it has become, practical has become 40 marks. These 10 marks we are increasing in the subject specific skill. In subject specific skill, we are going to give total 50 marks for the subject specific skill and 10 marks for the employability skill. So in employability skill, there is no change at all, but there is the change in basically the subject specific skill. Grade 12 also the same like the grade 11. That is the subject code, and here the board exam is also happening. So as a teacher, we have to be very very careful, because the external examiner may come, the observer may come. As the other subjects practical examination is going on as per the CBSE guideline, on in the same way the healthcare practical will also be going on. So we have to be very very careful in this year. that when we are going to prepare our students basically for the practical work. So they are also, they have to make one project based on their choice, whatever means when they are visiting to hospital. So any specific area they can choose to make their project, and that project work will carry 10 marks. Viva, when based on project and practical, will be taken during the final exam. Then it will be given as the 5 marks. Practical file, whatever the practical they will be doing in the whole 1 year, that the practical should be represented in the practical file, and that file will carry to 15 marks, and the demonstration of the practical will be done by 10 marks, total 40 marks. So these are the overall curriculum for healthcare in for grade 9 to 12. Now, just before entering in the basic things, what are the different activities we have to perform in the hospital? We have to train our students to perform in the hospital. We are going to observe one day how one GDA is dealing in the hospital. One day life of a GDA. Morning the GDA is coming to the hospital, and what kind of situation the GDA has to face when the GDA is present inside the hospital. One day life of GDA. This is the first video you have also as a teacher have to show to your students to motivate them, and this is not at all a easy job to do. It is very hectic job for the GDA to work day and night in the hospital. So we have to tell our students to take the mental preparation on that also. So let us see the video so that we as a teacher we will get a clear idea about the life of the GDA in the hospital.
Welcome to a day in the life of a general duty assistant. At the start of your day, you will receive a list of the patients you will be helping during your shift. Typically, the first thing you do when you enter a patient's room is to greet them and begin recording their vital signs. For many patients, you will also need to check their intake and output of fluids and record it on their chart. Next, if it is the meal time, you might assist patients with eating their meals. You may need to record how much the patients ate, especially for patients who are on special diet. After meal time, you may need to help a patient move their bed or wheelchair, take a walk, use the bathroom, bathe, or change clothes. You will ensure that the patient takes their medicines on time. During your shift, you may also have to change bed linens. It's important that the patient's linens are changed every day to help prevent the spread of infection. You may also be expected to help with general tasks like tidying a patient's room, removing dirty dishes, or providing drinking water. You will also be responsible for helping the head nurse with the additional duties as needed. To help you through the active day, you will receive timely breaks for meals, tea, or to freshen up. Always be on time for your shifts because your patient depends on you. It is important that you have patience and compassion when you talk to your patients. Focusing on the welfare of patients will always be your first priority. You will be spending more time with the patients than other healthcare workers. While handling the patient's personal needs, you will have the chance to observe them closely every day. So one of your most important responsibilities will be to pay close attention to physical or behavioral changes in the patient. You should be respectful to patients and their families, pay attention to details, cooperate with your colleagues, and manage your time. You will see many patients every day, so an important part of your job will be to manage your responsibilities and your time effectively so that you can best serve your patients.
So these the here we have seen the different skills we have to generate in our students as a teacher when they will be going to hospital and they will be working as the GDA. So one day, whole day, whatever they are observing in the hospital, that this is very important. So as a teacher, first we should know what are the different tasks the GDA they are facing in the hospital, they have to do in the hospital, so that we can make our students mentally prepared, so that whenever they have to be doing tireless work for the whole day and night, they have to be ready for that. It will not at all be a easy job to do, but it will really be very tough when they have to deal in the hospital with the patient. So they will not get the time to eat properly also. So they have to, maybe in their life there will not be too much time for entertainment, but they have to deal, because they have to be, then also they have to be empathetic with the patient situation, they, because the patients depend on them. So as a teacher, we have to inbuild these sympathy among our students, so that it will be really really very much beneficial, it will be for our country. Yes. Yes, Manoranjani ma'am.
Yes, ma'am.
Yes, ma'am. Ma'am, you also, I am starting with the basic curriculum right now. The theory
Okay.
part I am starting. So, when you will be, means, means the employability skill, we
Yeah.
can discuss it at the end, ma'am.
Yeah,
Like,
that's up to you. I can discuss now also. I'm
okay.
ready now, or even I can make it
Uh,
last also. No problem.
Ma'am, actually, now I have discussed with the curriculum is basically
Yes,
9 to
yes.
12.
Yeah.
So now in this session, first session, I have to discuss about the grade 9 and 10 curriculum in detail. So,
Okay.
so the employability skill, if you want, you can discuss now also, because employability skill is the first part of the curriculum.
Yes, yes. I can discuss now, ma'am.
Okay.
Uh,
Yes,
Pali
Jyoti.
ma'am, Manoranjani ma'am, Pali ma'am is speaking throughout by 10 o'clock,
Yeah.
and it's 11:20. I think we should take a little break for
Okay.
10 to 15
Okay.
minutes.
Okay.
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 Okay, it's
Okay.
11:20. By 11:35, we all will be
Okay.
back on our
Okay, ma'am.
online
Okay.
platform.
Okay.
Okay. Okay.
So
I'll
Okay.
all the
continue with the.
participants who all are watching, they also need a break to have a tea or something like that. So
Yes,
we
ma'am.
are on break now.
Okay,
Thank
ma'am.
you.
Yeah. Purely, ma'am.
Okay.
The break,
Ah,
I'll continue with this employability skill.
yes, ma'am. You continue. After that, I will start with the main curriculum.
Okay. Okay,
Yes.
ma'am. Okay.
Okay. Thank
Okay.
you, ma'am.
Okay, ma'am.
Pyali ma'am, Manoranjini ma'am,
Yes, ma'am.
welcome back after a short break.
Yes, ma'am.
So we should move ahead with our sessions.
Okay.
Yes, ma'am.
Thank you.
Okay. So now, ma'am, can you please help me in showing this PPT?
Yes, ma'am. Yes,
Okay.
ma'am. I'm sharing the PPT.
Okay.
Hmm.
Welcome back, everyone. I am happy that we are dealing with a wonderful subject, and that is health care, which is most important subject, I think. The whole education, I think we are talking about self-management, and healthcare is giving more important for self-management. So self-awareness in our life is the most important skill which we need to have. So here in healthcare, and we are giving very much importance for self-awareness. So when we talk about self-awareness, I think we need to talk about goal setting strategies. We all need to have a goal in our life. We help the children to have we help the children to have goal from, I think, from birth itself. So even first standard child, even second standard child, and we need to tell them that you need to have a goal in your life. So when we talk about healthcare subject, and without a goal in our life, I think it is not easy for us to help others and even help ourselves also. So goal setting strategies are very important in healthcare subject. So it is having, when we have better self-awareness, better goal setting strategies, and surely the career, we get a bright career, and future will be peaceful and happy. So here we talk about the self-management techniques, and then again time management. That is another very important aspect in our self-awareness in our life, and then critical thinking, stress management. So I think all these skills are very important: self-management skill, time management skill, critical thinking skill, and stress management. All the skills and which will help us to have self-awareness in our life. If we have better self-awareness, surely success will be in our path. So healthcare, since we are dealing with the physical and mental health, and self-awareness is very important. And employees, those who are working in this field, surely need to have this uh, kind of skill, and even we need to help others to have this skill. So employability skill, it is having 10 mark. Even though it is having 10 mark, it's very important. And in class 9, we are starting with employability skill, and the first and most important part is communication skill. And we always fail in our life because of lack of communication skill. Not only verbal communication, even other ways, physical communication or even other ways of communication, it is also important. So here in this employability skill, the first chapter is talking about communication skill, and next one is self management skill. I already spoke about it. And then ICT skill. Nowadays ICT skill is very important for us, and without the technology we can't live, and that is the kind of time we are living in. And then next chapter is talking about entrepreneurial skill, and then another one, and that's again one of the most important skill, that is green skill. So grade 9, the first unit, it is communication skill, and the chapters are, the sessions are introduction to communication, and then again verbal communication, non-verbal communication. I think non-verbal communication at times speak better than verbal communication. So that is also coming up here. And then writing skill, and writing skill, there we are talking about grammar part, that is parts of speech. And then writing skills, sentences is also there in class 9, and then pronunciation basics, and then greetings and introduction. In hospital sector, I think it is very important how we treat, how we greet people when they come to the hospital. We need to give them hope that they will surely cure. So the introduction, self introduction, that also is very important. And there the people get courage, the people get peace of mind. And then again talking about self, 8 chapters. Then again unit 2, it is self management, introduction in self management, strength and weakness analysis. So this is very important in self management, or even when we have self awareness, we need to know about what are our strengths. We need to concentrate more on strength than weakness, but we need to identify our weakness also. So section 2, the chapter unit 2, second chapter is talking about how to manage our strength and weakness, how to analyze our strength and weakness. And this is really useful for all of us, not only for the student. We also get a chance to understand our strength and build on our strength, and then work on the weakness side. And we need to concentrate more on our strength. And next chapter is talking about self confidence. So again, we all know that self confidence is very important, and the chapter is talking about that, and the children will be getting self confidence by studying that area. Then another thing is positive thinking. We always say that we all need to have positive thinking. And then personal hygiene, that's very very important in our life. Hygiene is very important, so we look at personal hygiene, especially in hospital industry. Hygiene is very important, so we all need to appear like, we need to feel that, and I am neat and tidy. So that's why the last chapter is talking about, section 6 is talking about grooming. So how we appear, our appearance, the staff appearance in the hospital is also very very important. It has lot of importance. Even though it's 10 mark, I think they are getting skills to grow up, to work with. So these skills, and we improve in our life, no, I think. So unit 4, again it is talking about entrepreneurial skill. So by having the skill, I think we get a chance to work ourselves. We can start a business also. So here the chapter 1, it is talking about entrepreneurship, and then role of entrepreneurship, and then qualities of a successful entrepreneur, and then again distinguishing characters of entrepreneurship and wage employment. So that is very much connected as a businessman, and we need to give salary or wages accordingly, where the employees must be getting satisfaction. And then we need to see that we are utilizing the money properly. So next chapter 5, it is talking about type of business activity, and then product, service, hybrid businesses. So lot of business opportunities are there nowadays, even based on the hospital industry itself. So it is talking about how to start a business and type of business, and then different kinds of product, different kinds of services, and then hybrid business, which is concentrating both product and services. And chapter 7, entrepreneurship development process. How can we develop as a entrepreneur? How can we have a proper kind of business? And that is 7th chapter. Then unit 5, it is green skill. I said, just like self awareness, green skill is also very important for our society and environment. We are facing a lot of problems nowadays because of lot of pollution. So green skill, and which give us awareness how to manage our waste management mainly, then how to support our environment. Chapter 1 is society and environment. Chapter 2, conserving natural resources. So we are actually, we can see that there is depletion of natural resources. So we need to conserve natural resources. It's talking about that. And by studying this, the children will be a responsible citizen, I feel. And chapter 3, which is talking about, uh, ma'am, can you please change the slide? And chapter 3, sustainable development and green economy. And we all know that we have a lot of importance in sustainable development goals. The whole country is talking about sustainable development goal. Piali ma'am, can you please
Uh, Ma'am, this is
yeah
now grade 9 is done, grade 10.
yeah Yes, I'm going to take grade 10. Okay. I can't see the slide, that's why.
Okay.
So now when we talk about grade 10, and there again we are starting with the communication skill, and there also method of communication, verbal communication, again non-verbal communication, they are studying little bit more on that. And then again they are studying about communication cycle, and what I say importance, and communication cycle, and communication cycle in the sense, and we are having higher grade officers, and then our colleagues, and then we have people working under us, and how to correlate this these kind of communication between higher authorities and people those who are working with us, and also people those who are working under us. So the cycle is very important, and we need to learn how to communicate with everyone and make sure that everyone is comfortable with us, and the higher management, they need to be happy with our what I say our actions and our communication level. And then chapter 5 is talking about barriers to effective communication. So that is also very important part. And then again writing skill, parts of speech, writing skills, sentences, here also they are studying. And then again in class 10 unit 2, it is self management skill, where stress management we have given lot of importance. And self stress management, there also we will be able to understand our strength and weakness. Self motivation is also very important. Self regulation, goal setting is also important. And self regulation, time management. So I think it's even though we look at the point of getting marks, it is only 10 mark, but this is helping the children to be successful in their life by learning about all these things. And unit 3, information and communication technology skills, basic computer operations, performing basic file operations, computer care and maintenance, computer security and privacy. So the people, they need to know how to save a file, how to document in the technology, maybe in the desktop or even laptop, and what are the privacy settings and security of computers, systems, and all these things they study, and they will be able to manage documentation. Here they learn to manage with the ICT skill. Then here also they are studying entrepreneurial skill, and entrepreneur and society, qualities and functions of entrepreneurs, myth about entrepreneurship. And earlier, and even entrepreneur means a business person, it is looking at as a landlord like that, but that idea has been changed, and the myth has been changed, and we are supporting as a businessman, as a entrepreneur, and we are supposed to serve the society. That kind of idea has come up. Entrepreneurship as a career option, and then again children will be able to become start own business, and how can we become an entrepreneur. So that also is mentioning in this particular chapter. Again here, green skills, sustainable development, again it is talking about, and that is need of the hour, our role in sustainable development. Each one of us personally, we need to see that, and we never destroy the nature. All our actions are towards helping the nature to sustain their natural resources, or even manage the or growth of natural resources such a way. And these are the important chapters in what I say class 10 also, class 10, grade 10 also, I think. So even though it is 10 mark, but these, I think the children will enjoy learning these skills, and they will be getting the skills, and we also as a teacher, we also improve upon in these skills. And this much about class 9 and 10
Yes, ma'am.
employability skill.
Now I will discuss about the different curriculum of the subject specific skill now, and Manoranjani ma'am will discuss about the means 11 and 12 employability skill also.
Yeah.
In our next session, ma'am will discuss in detail. So now we are coming back to our subject specific skills once again. So here in grade 9, the detailed curriculums are shown here. The detailed curriculum means in the name of the curriculum we have seen that first we are discussing about the healthcare delivery system. So when the about the healthcare delivery system we are talking about, so in details how we are going to teach the student, because if we give them only the theoretical knowledge, maybe the students will not be able to very much interested in learning the subject. So each and every concept, where in the sub concept also the activities are inbuilt. So if we do the activity and teach our lesson, I think it will be more helpful for the student to understand the practical knowledge also, as well as they will get the practical and theoretical both knowledge clearly. So under the healthcare delivery system, first what kind of activity we can do, we can visit any hospital or any clinic or enlist all the services, and whatever equipments they are using in the hospitals or the clinic, that we can show it to the students. So better we can visit means any nearby hospital in all over India, wherever our schools are nearby, any kind of hospital or any kind of doctor's clinic, with our students if we visit for one day, and we can list down that what are the services and what are the equipments they are using. The second one we are teaching in the subtopic, that is identify the components and activities of the hospital. So theoretically, when we are teaching them identifying the components and activities of the hospital, activity we can do, we can when we are visiting the hospital, on the same time we can talk to the different people who are working in the hospital. We can talk to them and we can ask about their roles and functions, and we can prepare a role, we can prepare a report also. As a student, our students can prepare the report for the students portfolio also, that and it will be very much helpful for them when they will means when they will complete their subject, they will complete their course. They can make their own portfolio report, and in their own portfolio report they can include what are the different kind of activities they have done in these 4 years of the course. So many students, when they are coming to us, they are having their own means in their family maybe any doctor will be there, maybe in their family any means person will be there who are attached to the hospital. So our students can talk to those people also to get the information about the hospital, what are the different activities are happening in the hospital, what are the different roles the doctors are playing, what are the different roles the GDAs are playing, and what are the different equipments the doctors are using, the GDAs are using for the betterment of the patient. Third chapter we are going to teach them about the roles and function of the clinic. The activity we can do, visit means any one or two clinics or doctor's office and observe the available preventive care being administered in those clinic, and prepare a report highlighting the services provided in the any two clinics that our students can visit, or any doctor's office also, as for the purpose of the interview our students can visit, and they can observe the available preventive care. Whenever we are going to any doctor's office, we can see many people are there who are using the hand gloves, who are using the face mask. So why they are using the hand gloves, why they are using the face mask, we can ask them the question, why they are using the preventive care. So as the healthcare professional, if they are taking care of themselves, so we can also take care of ourselves, so that we can also prevent the disease in our daily life. So that's why the interview we can do for them. Next one, describe the rehabilitation care facility. That is very important, and it is the fourth chapter of the healthcare delivery system. In this we can do the activity, we can visit a rehabilitation center and enlist all the services and equipment. Suppose any kind of people who are suffering from the problem of the drug abuse, who are suffering from the problem of the alcohol abuse, so basically the doctors for some days, if they will be kept in the rehabilitation care facility, so maybe they will be able to cope up with their normal situation, so they will come back to their normal life. So in the rehabilitation center we can make one appointment, and we our students can visit there along with us. As a teacher we can guide them to talk to those people who are working there, so that they will get the interest, they will be motivated by themselves to work on these areas. In our country nowadays the situation is like that, these kind of facilities are coming very highly, but we don't have that much manpower so that we can work together. So we have to means motivate our students in a way that they will be ready to come up and take the challenge of these kind of careeristic opportunities or careeristic goals for their future purpose. Now the long term care facility, that is very important. If any person is suffering from the long term illness, so that people will need the long term care facility also. These are the just now the Manoranjan just now when Manoranjani ma'am has discussed about the entrepreneurial skill, ma'am has already told us how to start a new business, how can you get a good idea to start a new business, what is means if you have the good ideas, how to implement that in your daily life to make a business, to become a businessman. So in the healthcare field also there are lots of opportunities where our young minds can find out the new ideas. In our country, if we see near means in our nearby areas also, how many long term care facility center will be available? I think the number will be very less, but we can motivate our students to make this kind of center where the people will come and get the long term care facility in the well manner. So what kind of activity we can do? We can visit along with our students to any kind of old daycare facility or center to study for the services and materials they are using. Hospice care is also very important, but till now that trend didn't come in our means country like a way ki, means hospice care, we basically we know the doctor's chamber, doctor's clinic, but what is the actual hospice care? Actual hospice care is that part where we can give the care to the patient, where they don't able to get the care at their home, because everywhere we can see the nuclear family right now, the people are very busy in their work. Maybe in the morning time the people they are going to their offices, they are going to their workplaces, at the houses some terminally ill people are there, means but the earning is also very important, so we don't have any other option, we have to leave the patient at home and we have to go for our own work. So these hospice care center will give them that specific care what they need in their life. So these are the different activities we can perform in the healthcare delivery system. Now come to the second part, that is the role of patient care assistant. The first chapter is based on the role of the patient care assistant, and here we can volunteer and we can visit any primary health center, nursing home or community health center. It will not be any big hospital. We will train our students to go to any primary healthcare center, any nearby hospital or nursing home, and where the community health center are there, and they will go, they will talk to those people, they will talk to the GDA staff there, and they will get the idea that along with the big hospitals, how the small nursing homes or small community healthcare center are also helping in our society. They have to know about that. Identify the various activities of patient's daily care. How to do that? The activity we can do: prepare a daily care plan for the patient. Suppose any of the student can have one patient at their home also, any old people at their home also, their grandmother, grandfather, maybe they are suffering from any disease. So we can tell our we can tell our students to make a daily care plan for that old people or for that patient who is there in the society or in the neighborhood or in the relative or in the house, wherever. So role play, we can tell the our students, among our students only we can perform the role play. like one student will be acting as the patient, other student will be helping the patient, and that role play will give them the clear idea that how can we take care of the patient at the home also. So and they will identify and apply the most suitable safety practices that should be followed in the given situation. In this situation, it is very important the safety practices. We have to train our students to maintain those safety practices, because whenever we are dealing with the ill people, when we are dealing with the patient, when we are dealing with the people who are not well healthy, who are not healthy in proper way, so we have to be very careful with those patients. So safety practices are very important. When we are dealing with any old people at our home also, always we have to take care that, or even the children also, when we are dealing with, they should not put anything in their mouth, they should not fall down, they should not get any sharp object in their hand. When we are dealing with any old people, we have to be very careful that they should not fall, nothing slippery should be there on the floor. The door or the window should be properly fixed. Nothing should fall on them. They should have the proper stick on their hand to work. So these are the different areas we have to train our students, so that they will be aware about all those things and they can make our society more better. The basic requirements for the patient comfort, this is very important. The role play, we will provide the role play, right? If I am the patient, I am not feeling well, so what will be my attitude? So when I am getting angry as the patient, the general duty assistant or the GDA should be calm and quiet, kind, because I am not feeling well. So as a patient, when I am not feeling well, if I will get the comfort from the GDA, so I will feel very happy. So when I will get the recovery from the hospital, I will give the positive comment about the hospital. Ki these hospital staffs are very good. They are very kind. They take care of the people in very means perfect in very perfect way. So automatically, so if as the hospital will also get the name on that. Ki if they will get the trained and very kind professionals in their hospital. So we can do in the school as a teacher, how we can implement that, we can provide one role play and different situation. We can give the situation, like suppose we can give the situation to our student ki you are you are, suppose you are working as the receptionist. So one another student will come, where that is the patient, and one attendant will come, and we can give different situation, like one reception we can give one situation, we can give one situation like operation theater, we can give the situation like the pediatric care, and the students have to do the role play so that they can get the idea how to deal with different kinds of situation in the hospital. Now the next one, the various aspects of the patient safety. Just now also I have discussed about this point, and the activity in any hospital, once or two times we can visit the hospital in the whole year, and we can do the theoretical part we are going to do in the school, but the practical part once in term one and once in term two, we two times we can visit to hospital, and all the interviewing process or all the communication with the doctors or communication with the GDA, that processes can be done when we visit to the hospital also. The quality of a good patient care assistant, it is very important to inbuild these patient care, good quality of the patient care assistant in the in our students, in our future generation. It is very important. Whatever activity we can do, we can prepare a checklist for the health parameters, like our normal body temperature. Our normal body temperature is 98.4 degrees centigrade. So when 98.4 degrees centigrade, as a student, they know that it is the normal temperature. When they are measuring the temperature at home and they are observing the temperature is 100 degree or 101 degree, then and there our students will be aware, and they will give the proper guidance for their family members, their neighborhood, their society, their relatives. Now you should go to the doctor because means your health parameter is not matching with the normal range. The our students should know the blood pressure. Normal blood pressure range is the systolic blood pressure rate should be 120 mmHg. The diastolic blood pressure rate should be 80 mm of Hg. So when the normal blood pressure range they know, if the pressure will be very higher, so then they will guide the patient to go to the cardiologist doctor. You are suffering from the hypertension, so definitely you should visit any cardiologist doctor. That's why checking of the normal health parameters are very important, and creating the awareness on that is also more important than that. Okay. And in the school also, sometime in the school, suppose in one grade 11 12 students, they are facing so much stress and tension, they don't even know ki they have already hypertension. Because at their age, if we see in our nearby areas, do they go to the hospital or doctor if they don't feel any health problem? No, we also don't go. Any health problem if we face, then only we go to the doctor. But in their body they are getting the hypertension unknowingly. So when they will, our healthcare students will check the health parameter in the hospital among our own students of our own school. So we will come to know if any child is suffering from hypertension or not. If we get any kind of that kind of child, then and there we can inform the parents of the child, or we can send the child to any doctor, so that the hypertension disease can be diagnosed very fast, and it can be treated in well manner, and we can save the life of that children. We can save that child's life from any serious problem in future. So that will not only be beneficial for our society, that will really be beneficial for our school also. And so that's why yeah, this is very important. Ethical practices in hospital, very important. Whenever we are going to hospital, what are the different ethical practices we should maintain? We should never and ever do any kind of unethical thing in the hospital, because hospital is a place where already many patients are there, many disease causing organisms are there. We have to make the like self practice to protect ourselves from the different kinds of disease causing agent. So smoking should not be done in the hospital. Alcohol means alcohol consumption should not be acceptable in the hospital. So we can train our students in a way that they will be aware about the ethical practices taken care of in the hospital. And last one, in the role of patient care assistant, that is called the biomedical waste management. In the biomedical waste management, it is not as simple as how we are managing the garbage at our home. In our means in our home, when we are thinking about the garbages, so that is basically all the household products, the vegetable waste and all the packets and everything, chips packet, like that thing, simple things. But when we are thinking about the hospital biomedical waste management, we have to be very careful, because in hospital the people, the GDAs, the doctors, they are dealing with so many hazardous things, so many hazardous chemicals, so many hazardous microorganism, bacteria, virus, protozoa, parasitic infection they are dealing with. So whenever any body fluid or blood is coming out from the patient body, so that also we have to deal with very carefully. We are using the syringes, we are using the injections, we are using so many sharp objects in the hospital. How to where to dip that, where to keep that, how to dispose that. Sometime we can dispose it in the landfill, sometime in the incineration method, sometime by autoclaving method. So these are the different methods we can use to dispose the biomedical waste management. So whenever we will visit to hospital, we will talk to the doctor, we will talk to the GDA, how they are dealing with the biomedical waste management. Suppose the surgical material, when any surgery is done, and from the patient body whatever material has come out, how to dispose them. They have to know all those things in the in this healthcare subject. Now, personal hygiene and hygiene standard, what kind of activity we can do, good hygiene practices we can maintain. The good hygiene practices, that is very easy thing we can show, that is like one hand washing technique. In this context, I also want to show you one hand washing technique that we can perform as a practical in our school also. One simple hand washing technique. Just 1 minute. The hand washing technique I will show you by the another PPT also. So there the hand washing techniques are there. So this is the basic hand washing technique. We have seen it here. And whenever we are training our students in their daily life, we can tell the students to follow this kind of hand washing technique in their daily life, so that till the time they will go to the hospital for working, they will be enough, they will be very much trained about the health means hand washing technique. And these hand washing technique will be helpful for our students also, just to means in their daily life also they can prevent different kinds of diseases, they can get rid of different kinds of diseases. And as a teacher also, if we follow this hand washing technique in our daily life, then also we are able to take care of, and we can prevent many diseases in our life also. Now the next one, what are the different factors that affect the good health? So preparation of the checklist of the health parameter, that in the previous lesson also we have done that, when we have learnt about the role of means GDA. So role and responsibilities of the GDA also. So that that various health parameter in the second lesson, when they have already done it, so when they will visit to the hospital and they will perform any kind of physical activity, so they will be able to explain their advantages and limitations also. Suppose we know कि our breathing rate or respiration rate is 12 per minute. So when we are doing any physical exercise, like we are running or we are jumping or we are hopping or any exercise we are doing, our breathing rate is getting increased. Already we know that our pulse rate, that is normal parameter, is 72 beats per minute. So when we are doing any exercise, so automatically our pulse rate is getting increased. Why our pulse rate are getting increased, and what are the different kinds of limitation can happen when our pulse rate are getting increased. So that are the different activities they can perform the hand washing method that already we have demonstrated that they can do. And personal grooming is also important. What is the personal grooming? That is the hands on practice and session on grooming and other practices related to personal care and hygiene. So we have to train our students in a way so that in our daily life when they come to school they should maintain their personal hygiene. And we as a teacher also we have to be very very careful to monitor that really they are performing the personal hygiene in their daily life or not. And they can create the awareness problem for the other children also. If they will come to the school in a proper way in proper uniform, they take the bath and then they come to school, they comb their hair in a proper way, they bring the good nutritious food to eat, so automatically in their class their other students will also be motivated. And in the school also we can make a very healthy environment for doing these practices. Primary healthcare and emergency medical response. Here, the essential components of the primary healthcare and emergency medical response we have to teach theoretically. And in the activity part, basically we can volunteer at any mother and infant, like the newborn baby, in the family or in the neighborhood or in the society or anywhere. If any of the student has got any newborn baby, or so they can go and interview the newborn the mother of the newborn baby. So what are the different millennium developmental goal? Did the pediatrician doctor told the mother about something, that how when the newborn baby will be growing up, so what are the different changes are happening in the infant body, when what are the different changes can happen in the child body, what are the different changes can occur in the adolescent body. So they will come to know about all those things. They can, if they want, they can visit to any pediatrician doctor also, so they can interview the doctors also, so that they can come to know about what are the millennium development goal or mdg goal related to the health. And everybody as a teacher also, we it will be very much helpful for us to take care of our student, because as a teacher when we are dealing with the different age group of the student, like the age group from nursery to the kindergarten student, and when we are dealing with the middle age student, like the preliminary age students, school going children, when we are dealing with the adolescent children, so as a teacher if we know what are their needs, what are their health, so it will be very very easy for us as a teacher to deal with our students also. The chain of survival. The chain of survival is basically that is the demonstration of the basic first aid practices. Our students can make their own first aid box, they can keep it in our school laboratory, like in our healthcare laboratory or in the sick room, so they can practice the basic first aid practices in the school whenever it is needed. Now immunization is also in the curriculum of our grade 9. And the type of immunity, what are the different type of immunity, like the innate immunity, acquired immunity. So when the newborn baby is coming to the world, the newborn baby is already having the innate immunity. How the newborn baby is getting the acquired immunity? When the baby is drinking the mother's milk, colostrum, what are the different types of immunity they are getting, IgA, IgE, what are the different antibodies they are getting, they will come to know about that. What are the different immunization chart the baby has to take the immunization for, what are can create the awareness to their family members, like the parents of the child. So many in if we see in the different areas, many parents are not even aware about the immunization program of the child. So if the child is not immunized properly, so many devastating diseases can come, disastrous diseases can occur in the child's life. And easily by giving one simple immunization program, we can save the child's life. So these kind of awareness program our future generation students can do, and we as a teacher we can initiate, we can motivate them to do that, so that we can save our society. Immunization schedule. Suppose at their houses or at their society, any kind of means any child is there, the mother is not that much aware about the immunization schedule. So one injection should be taken just after the birth, another injection should be taken after 1 month, other injection should be taken at after third month, another injection should be taken after 6 months, but the parents are not at all aware about that. So as we can train our student in a way, they can make the awareness in our society, so that we can educate all the parents. As a teacher also we can do, as a reformer we can do, we can educate our society through our students, so that we can save the many child's life in future. Key components of the universal immunization program: we have to create we have to enlist the diseases, our students, we have to train our students to enlist the diseases covered under the universal immunization program. And they can work as the social reformer, they can go, they can visit, like the community outreach program also can be included here. They can visit their nearby areas, they can visit their relatives house, and they can give some awareness for the parents ki these are the very disastrous diseases. Did your child get the immunization program for this? So the parents will also, because parents always want the best thing for their children, so only that awareness program they need to do the good for our society. As a teacher we can implement that through our student in our society. The pulse polio immunization, that is very very important. Once upon a time in our India, many people used to suffer from the pulse polio, but nowadays if we see the rate of pulse polio, the rate of the polio disease has been it has come very down. Why it has happened? Because our government has taken the initiative for the pulse polio immunization. They have made the campaign for the pulse polio immunization. Each and every child, whenever they are taking birth in our India, they are getting the pulse polio immunization. So we are through these courses, the healthcare course, we can train our students, we can initiate that means the program, means we can tell our students to make our society aware about the pulse polio immunization, so that we can make our India completely polio free. And the enlisting the different diseases that will be coming under this. Now coming to the grade 10. Grade 10, if we see, basically the first chapter, it will be almost similar like grade 9 only, healthcare delivery system, but the sub concept of the chapter, it will not be accurately same like the grade 9, because grade 9 they have learnt about the introduction part of the healthcare delivery system. In grade 10 they are going to learn about some extra information like the activity. They have to prepare a chart depicting the roles and function of various departments, professional supportive staff. Role of the supporting department in the hospital, like the prepare the chart showing the chain of the commands in various departments. When the doctor is giving any command, how the other professionals are facing, how the other professionals are practicing the just to give the better treatment for the student. Classify the hospital. In our area if we see, many hospitals are available, like the primary hospital, secondary hospital, tertiary hospital. Which kind of hospitals are giving what kind of treatments, we have to discuss that. We can visit the nearby primary hospital, we as a teacher we can take our students to the secondary hospital. We can make our students to differentiate between the primary and secondary hospital, what are the facilities they are providing. Once upon a time we can visit any tertiary hospital, and we can show our students what are the different what the services our tertiary hospitals are providing to us. And the roles and functions of the GDA. Draw a diagram depicting the roles and the function. We can make the role play also in the class in this context also. And the last part was the qualities of GDA. Qualities of GDA is very important. Many times we have discussed on that ki the GDA, general duty assistant, they should be very kind, very empathetic, very sympathetic. They should be very much, they should have very much patience level in them. So in this way we can discuss about the qualities. Now introduction to care plan and the patient. So what is the first topic in that? Role of the GDA in care plan. What are this is theoretically we have to teach. Along with that we have to teach them how to feed a patient. We can prepare a diet chart based on that. Suppose one person is facing the problem where the patient cannot swallow the food, so how can we give the food to that specific patient? What kind of liquid food we can use, what kind of semi solid food we can use, what kind of light diet we can use? So based on the, suppose one mother, for the mother is one lady is going to be mother, so at the first trimester what kind of food the mother should consume, at the second trimester, at the third trimester, what are the different kind of food the mother should consume. The lactating mother, when the mother is doing the breastfeeding for the baby, what kind of food the mother should take, so that we can save the baby and it will be helpful for the baby for acquired immunity also. Okay, because so these are the different areas where we can train our students to prepare the diet chart for the feeding of the patient. Next one, identifying of the various vital sign. When the practical should be done, so performing the procedure, the recording of being done for vital sign like the temperature, pulse rate, measuring blood pressure, heart rate, temperature, BMI, respiratory rate. So these are the different vital sign. Our students should know how to do that. This is one practical part actually. Make the bed for the patient. Suppose one patient is lying on the bed but the patient cannot move, the patient is immobile, the patient cannot even move from one side to other side. So how to take care of this kind of patient, how to change the bed sheet in the occupied bed. It is not only for the hospital, at our houses also. Sometime if anybody is getting the fracture in any part of the body, maybe the person is not movable, so if we train our student in a way, they know the process of changing the bed, the creation of the bed, so it will be helpful for them to help their family members also. Next one, the different practical we can do in this context: preparing the bed for the patient, understanding the features and importance of various types of bed in the hospital, describing the various steps of the bed making, and understanding the role and functions of the general duty assistant in bed making. So in this context, I want to show you one video also, that how we can make the bed for the patient. Because making the occupied bed is a difficult process, we can teach our students to do that.
I have the lift sheet, I have the soaker pad, and then a flat sheet and a pillowcase. I'd knock on the door. I would sanitize my hands again when I walk into the room. Good morning, Annie. I'm Myra, and this is Kim. We're gonna change your bed for you. Is that okay? We would pull the curtain for privacy, and then I would put the linens down on a clean surface, and then I'm gonna flip them over. Since I got them in the order they go on the bed, we're gonna flip those over. Annie, we're gonna raise the bed up so we can help you a little easier. Okay, I'm gonna put on my gloves because we're removing dirty linens first. And we do have a linen bag for the dirty linens on the other side when we pull them out from underneath Annie. Okay. Annie, I'm gonna have you scoot a little closer to me and then we're gonna roll you onto your side. Is that okay? Okay, we're gonna move on 3, 1, 2, 3. And now I'm gonna roll you over onto your side and Kim's gonna hold you. 1, 2, 3. Okay, we're gonna keep her covered. Is it okay? Okay. I'm gonna roll all these dirty linens to the middle. Try to keep those away from. Okay, now I'm moving to clean linen, so I'm going to take off my gloves. Throw those in the garbage. Sanitize my hands.
Still doing okay?
And keep the sheet flat on the bed. And I'll just put that to the middle. Make sure there are no wrinkles in the bed to prevent any pressure sores. And we'll take the lift sheet. We want to go from the shoulders to the hips. The fold should tell us where the middle of the lift sheet is, so we know how far that should be underneath her. And I'm going to fan fold that down. I'll do the same with the soaker pad. Again, using the fold in the middle. Okay. All right, Annie, we're going to have you roll back over. There's going to be a big bump underneath you. We're going to use the lift sheet on that side. 1, 2, 3. Okay. And then Kim's going to get all the dirty stuff out. I'm going to keep you covered. You doing okay? Yeah. And she'll throw that in the linen bag. And she's going to take off her gloves and wash her hands. All right, we're almost done, Annie. She's just going to pull that clean linen through on the other side. That's the top sheet.
Is it? Nope, there. Okay.
She's getting all those wrinkles out so you have a nice smooth bed.
Smoothing out.
Yeah. Okay, I'm going to let you back down on your back. We're going to use that lift sheet to get you back in the middle of the bed. 1, 2, 3. Okay. Everything feeling okay? Okay, last thing we need to do is change your top sheet. So we're going to get that situated at the bottom of the bed and then keep you covered while we take the dirty one off. Okay, that's your side. Okay, so we take this dirty one off. We'll cover you with a clean sheet. There we go.
So this is the way it is shown here ki how the teacher can train a student in the school itself to do the just to perform the activity. Like if any person is already occupying the bed and the person is immobile, so how the bed can be made in that case. So now we are going to continue with that. So bed making is very very important in this context. And last one is the patient positioning. Patient positioning is also important. If the patient is suffering different kind of problems, how to position the patient. Different positions are there, like side laying position, Fowler's position, supine position, prone position. So which position the patient should stay to get a quick recovery from their specific diseases. So that are the different we are going to teach the students based on that. Sterilization and disinfection is also very important in this manner. Disease causing microorganism. What are the disease causing microorganism? So the students can make the chart basically, what are the normal disease causing microorganism based on that. And causal agent of the common diseases. What are the different causal agents are there? How to prepare the chart, means how these disease causing organisms are creating the diseases. So that chart they have to prepare. Role of hospital personnel in prevention and control of the hospital acquired infection, like the activity, means how to prepare the chart about the activities performed by various professional in the prevention of microorganism. How the hospital people they are taking the different, how they are taking the different roles, how they are performing their roles just to prevent the microorganism, means the outbreak of pandemic or epidemic in the different areas, how they take care of that thing. So that only that not only the hospital personnel, but as a means normal human being also, if we follow those rules and regulations, if we can teach our future generation about those rules and regulations, so it will be very very helpful, so that we will not get any kind of hospital acquired infection. Because there are many microorganisms, if we don't visit hospital we don't get them in their body, but that's why they are called as the hospital acquired infection, because that specific infection comes from the hospital. We have to train our students in a way कि whenever they are going to hospital, how they can prevent to get the hospital acquired infection. Okay, when they will deal with the patient in the hospital, how they can protect the patient to get the hospital acquired infection. That is coming under the sterilization and disinfection part. And disinfection of the wards and equipments are also very important. Here the students will prepare the chart about the common methods for the disinfection in hospital. What are the different methods the hospital care means care professionals they are using to prevent the disease causing organism in the hospital. Basic first aid and emergency medical relief, that is the part, it is already means it will be taught in grade 10 basically. There we are basically going to teach about the principle and rules of first aid. We can perform the practical, the preparation of the first aid box, the facilities and equipment of the material of the first aid box, what we are basically using, in which kind of situation we can use the first aid box, in which kind of emergency the first aid box can be helpful for the students to save the life of the people. First aid in different common emergencies. Okay, in our daily life when we are getting any emergency, how the first aid can help. And they are the role play, the students can perform the role play also, they can perform the activity also for measuring and controlling the temperature. They can make one demonstration about how to use the first aid box in different kind of people also. The human body structure and function and nutrition, they are going to learn in grade 10. Identify the parts of the human body. What are the different parts of the human body? We can show them by the different means demo model we can show them. And they will identify the different organs of the human body, the different systems of human body, like the nervous system, muscular system, then the circulatory system, excretory system, then bones, joints, everything they are coming, they will be knowing in the part of the human body. The role of nutrition in the growth and development, very important. Till now in India, many areas are there where the people are suffering from malnutrition. The children are suffering from malnutrition. They have the proper amount of nutrition around them, but they don't know what to take. It is not only in the different areas, sometimes in the urban areas also we can see the nowadays the children, they are getting very much prone to get the, specifically in the eating of burger, eating of pizza, eating of the unhealthy food habits. So that is very dangerous for our future generation also. When the unhealthy food habits will be generated, so now they are children, but when they will be grown up, they will get the hypertension, diabetes, obesity, these kind of diseases very fast. So we can make the students aware about that, so that they can create the awareness about these kind of diseases, which so we can save our country also in this manner. And the preparing the balanced diet chart, it is very important. What we can do as a teacher, we can tell our students to make the chart of the balanced diet, because already we are teaching them in their theoretical knowledge. In the practical knowledge, they are preparing their balanced diet chart. When they are preparing the balanced diet chart, we will tell them to follow that. And not only that, we will tell them and we will insist them to follow that specific balanced diet chart at their home also, so that all the family members will be benefited from our students. We will tell our students, we will train our students to talk to their friends, and just to insist their society members, just to insist their neighbors, just to insist their relative to follow that balanced diet chart. So if all the people will take the balanced diet, maximum diseases can be prevented by our hand only. As a teacher, we can do lots of change in our society, and we can train our students in different aspects, so that we can save our society, we can save our country from many diseases. Last part of the chapter means of grade 10 syllabus, that is called the public relation. It is basically the receptionist part, reception work. When the first time meeting with the patient, and we all know the first meet impression is very important. First meet impression, when we meet someone for first time, what is the approach the person is showing, that is very important. When the patient is visiting to the hospital, so by the time the receptionist, how they are behaving with the patient, how they are behaving with the attendant, very very important, because that is the first impression of the hospital towards the patient. So we have to train our students in a way कि they will be able to maintain that kind of rapport with the hospital and the patient. They can respond to the emergency calls, they can use the computers in maintaining the public relations, they can deal with the patient attendance carefully. And in this area, suppose we can do one role play also in our classroom while teaching that lesson. The one means one set of students will be acting like the patient's attendant, and another student will be like the caregiver. So they will deal with the different kinds of situation. We can give the situation as a teacher to them, just to think about then and there, how to take the prompt action on that specific situation. So we have to train our students in this manner. So now grade 11 and 12, we are going to discuss about the curriculum in our next session. After lunch session, we are going to discuss about. Now we are going to discuss about the different practicals we have to perform in our class while doing the these practicals, they have to write down in their practical file. Okay, these are the different practicals the students have to perform in grade 9. Like they can enlist all the services, because already these activities we have discussed in our session, in our first session, what when they will visit to hospital, what kind of different services or what kind of different areas they can talk to the healthcare providers. So next one, as a healthcare provider, the student will observe the preventive care being administered in the medical room room and prepare a report highlighting the services. Now, when they will talk to the doctor, they will ask that if a patient is suffering from fever, is coming to your hospital, what kind of treatment you are providing. If one patient is coming to your hospital with the chest pain, what kind of services you are providing. So we as a teacher, we can give them different areas also to work on, so that, or they can work on their own interest also, so that different highlighted services we can work on. Students will prepare the care plan, but that is basically non formal, because our students are not the certified healthcare provider. So as just like a demonstration, they can prepare the care plan for the elderly people, and that can be provided by the family members. The one thing we can do before going to hospital only, we can tell our students to prepare the for a non formal care plan, and when they are visiting the hospital, they can talk to the dietitian that whatever care plan or diet plan I have prepared for the elderly people, is it correct or not. They can talk to the doctor ki whatever care plan I have made for the giving the best care for the old age people, is it correct or not. So when the doctor or the dietitian will tell, the professional will tell them that yes, you are going through a good way, and you are like you are doing the correct thing, so they will get the motivation from there itself. In the medical room, the students will identify the list of various elements that can help in providing the comfort of patient. That is very very important. When I think just now when I have shown the video to you, the how to make the occupational bed, means as a teacher you may have seen that every time the GDA was asking the patient, "Are you okay? Are you okay?" So that is very important. We have to communicate with the patient in this manner. So comfort of the patient, if we don't ask the patient, "Are you okay?" So how can we come to know the patient is feeling comfort or not. And if we ask the patient that, "Are you okay?" the patient will feel comfortable. So we have to train our students in a way so that they will be able to provide the proper comfort to the patient to whom they will be dealing with in future. The another practicals, the students will prepare the checklist for the health parameters as per their understanding and compare with the standard checklist. So they already know in the theoretical part key what are the different health parameters. When they will do the practical in their school, and they will come to know about the different healthcare parameters of other students, they can tally it, like what which students are not having the proper healthcare normal range of health parameter, they can direct them to go to the specific doctor. The students will prepare the chart of different situation on daily life with suitable safety practices that should be followed in the given situation. Then they will create the awareness about these kind of safety practices among the teachers and students. They can take one orientation program one day in the assembly just to create the awareness, so that the whole school will be benefited from that. The students will make the report about the color code, about the disposal of the biomedical waste. Suppose in the sick room when they are working, they are also they can create the different kind of waste management technique, like blue color, the like the green color. Already we are maintaining that in different areas, like the wet waste will go in different color, the dry waste will go in different color. So we can work on that with our students collaboratively. Students will demonstrate the hand washing technique, their nail trimming technique also, that they will demonstrate. They can take the picture of that and they can paste it in their practical file also. And the students will perform the various physical activities to explain the advantages and limitation, what are the different roles of the exercise in our daily life, how the yoga can be helpful. So these are the different pictures they can take, and they can paste it in their file. The students will prepare the sample immunization schedule chart for newborn baby, like it was the part of our immunization program. The students will enlist the disease covered under the universal immunization program, and they can prepare the chart on that. The students can decorate the board in their classroom about the immunization process, because in the grade 9, 10 also, suppose anybody can take the immunization program like the girls can go for the HPV, that is human papilloma virus, that is very dangerous, and we can prevent the cervical cancer if we take the vaccination on beforehand. So where this is the awareness our students can generate among our own students, so that the tetanus, that is very dangerous disease, but we can get the vaccination of tetanus, we can get the immunization process of different diseases, and that awareness can be created by our own students in the day. Like at the 10th November every year, to celebrate the World Immunization Day, we can celebrate it in our school also. The students will demonstrate the basic first aid practices in our school. The healthcare provider, as a healthcare provider, the students will practice the responding to the medical emergency in our school also. They can practice the process of CPR, that is the cardiopulmonary resuscitation. They can do it in the demo also, in the demo method, on the dummy also they can do it. And the students will enlist the essential component of the primary healthcare provider. So these are the different practicals our students are going to do in grade 9, and they are going to note it down in their practical file. Grade 10 also almost similar, nothing that much big, but something different they are going to do. Because they are going to draw the diagram in depicting the roles and functions of JDA. They can assume them as the healthcare staff, and they can make prepare the cards for them for denoting the good qualities, like that they can make that I am honest. They can make the card like a card like I am I have high patience level, and they can denote themselves so that they can correlate, they can find out their own strength. And if they find out any weakness, then they will be able to get the chance to overcome that weakness. So we in this way, as a teacher, we can train our student in a way that they will identify their strength and weakness in well manner, and we all can work on that. As a healthcare provider, the student will prepare the diet chart, like for the different kinds of diseases. Not only the general care plan. Care plan is made by grade 9 students. But in grade 10, some more specific, specialized way we can do that. Like in diabetes, what kind of diet chart? Pregnancy, what kind of diet chart? If any person is suffering from anemia, what kind of diet chart we can provide? So these can be given as the project work also. The student will measure the blood pressure, heart rate, temperature, and BMI of the volunteer in the school. They can prepare the bed for the patient. Just one demonstration for our teachers' purpose, I have shown you in this session that how the occupied bed can be made. So we, by using the dummy also in the class sick room, we can train our students to make the occupied bed. It will not only be helpful for the hospital to when they will go to work, but at home also. If anyone will be there in at home who is not, that patient is immobile, so it is not only beneficial for students also, for teachers also. If we are dealing with this kind of situation, this kind of method, if we train with our students, it will be really helpful for all of us. And as a healthcare provider, the students will place different volunteers on the bed of the patient, and then they can make the bed accordingly. The students will prepare the chart about the common human diseases, their source of infection, causal agent. So if we know the causal agent, so we the prevention we can do very easily. So we have to train our students in that manner. The students will use the chemical disinfectant in the medical room to ensure the reuse of the glassware periodically. Means whenever the patient is using any utensils or anything, how to take care of those utensils. So these are the what kind of disinfectant chemicals we can use in our laboratory to get rid of different kinds of microorganisms. Students will decorate the board about the prevention of microorganism to create the awareness. When it can be done, it can be done on 7th April, that is the World Health Day. The students will perform the airway breathing circulation on dummy, that is called the ABC circulation on dummy they can perform. This is very helpful to save life at any stage, at any area, at any place. We can save the life of anybody if we know the ABC, that is the airway breathing circulation. So we can perform it in the dummy, we can train our students to perform it in the dummy, but whenever necessary we can follow it in our daily life also. The students will enlist the methods of sterilization, disinfection, and that can be followed in the medical room. The students will prepare their own first aid box and they can use it whenever it will be needed. Or not only dummy, if it is important to use in any human being, they can use it also. But as a teacher we have to make sure whatever things, whatever ointments, whatever medicine they are using in their first aid box, we have to be very careful they that didn't cross the expiry date. We have to be very careful as a teacher. We should be very very mindful on this manner, because how much helpful it is. If their first aid box is not made in the proper way, it can be harmful also. So as a teacher we have to keep a look on that. The students will make working model of different body system like the circulatory system, respiratory system, urinary system, cardiovascular system also. And the students will prepare the balanced diet chart for all age group people, starting from the one primary children, starting from the adolescent child, starting from the adulthood, the lactating mother, the different trimester of the pregnant lady, the old age people, any specific disease if the person is suffering from, then how to take care of that. All age group people, all the kind of diseases, what kind of basically balanced diet plan we can provide. So in this way we have completed up to the curriculum part discussion about the grade 9 and 10. We have discussed about grade 9 and 10, and in our next session basically we have to discuss about grade 11 and 12. So 11 and 12 employability skill we are going to discuss, and 11 and 12 curriculum, theoretical curriculum. Along with that, what are the different practical curriculum we can follow for our students, we can discuss in our second part. The Jyoti ma'am or Manoranjani ma'am.
Yeah.
uh,
We break for lunch, it seems. And
uh,
Jyoti ma'am is here.
Jyoti ma'am.
Yes, ma'am.
Ma'am, already we have covered about the curriculum of grade 9 and 10. Discussion is done, and the practical also, whatever the practical we can do perform for our students in the school basically, that also we have discussed. And how they will make their project work, how they will do the practical work for grade 9 10 we have completed in our first session.
Yes, ma'am. Now
Yeah.
it's a lunch time also.
Okay. So by what time we can meet, ma'am?
By 1:30.
Okay, by 1:30, and we will discuss about grade 11 12 in second session.
Sure, ma'am.
Okay,
Thank you so much.
thank you, ma'am.
So, ma'am, Manoranjini, ma'am.
Yeah, shall we start, ma'am?
Yes,
Yes, ma'am.
sure. We should
Okay.
continue with our session. Welcome
Okay.
back to all of you after a lunch break.
Okay, ma'am.
Okay, then we should continue.
Okay.
Over to you, both of you.
Okay, good afternoon, everyone. And again, we are starting with the first part of 11th and 12th, that is employability skill. Okay, 1 second. Okay, when we talk about the employability skill, again, 11th, it is coming communication skill again, the next level of communication skill. And here, and we are talking about verbal communication and also non-verbal communication, how people should be there in the hospital, the employees of hospital, and what kind of communication we are supposed to have with the patients, because most of the patients, they are coming to the hospital for better care, and even with a lot of pain and ailment. So the communication should be effective communication, empathetic communication, and which will surely support the patients. So the introduction to communication is the first unit in class 11. And then again, here we are talking about the next level of verbal communication, and then non-verbal communication also. Our appearance also speaks a lot. So how we are supposed to appear before the patients, the people, that's also important. And again, pronunciation, basic pronunciation, and with our pronunciation, the patients must be able to understand what we say. And then the styles of communication, and especially assertive communication, and towards the patient, assertive in the sense, at times we should not be rude, but we need to be stable, and we need to guide them in a such a way. So sometimes the patients also trouble us, so then that time we need to be very polite and we need to be assertive. So here in this particular chapter, we are talking about that kind of communication, where we are taking care of the patients and we are assertive also in certain things. And saying no, refusal skills. How to say no. Here the assertiveness, and the next chapter, saying no. How to say no to the people, and that also the polite, very polite way we are supposed to say no to the people, especially in the hospital industry, because we are dealing with the patients. What we expect people, how the people we expect, how they are supposed to deal with us, same way we need to be in their shoes. And our communication should be effective communication. At the same time, while we are saying no, we need to see that the people are comfortable with our communication. So that is there in section 6. And then writing skill again here, and we are learning about the parts of speech, the grammar area, and where we should not make any mistakes, and it should be very clear communication with the parents, even if it is written communication. And then sentence framework, and here also it is coming. And then greeting and introducing the people, and how we are supposed to greet the people, and that's also very important. And the people feel that they are safe over there, that such a way we are supposed to greet the people. And the introduction also should be such a way where the people must feel that we are there just to care for them and to support them. So session 9 is actually dealing with that kind of information. And then again session 10, again talking about the self, how we are supposed to appear before, what is the purpose of we people as the employee, as an employee, and we need to understand our role and ourselves also. 11th chapter, again asking questions, and again how we are supposed to ask questions, and it should not be the way questioning, and but we need to clear what is their uh, need, so such a way we are supposed to, and that kind of things are there in section 11. Again section 12 talking about family, section 13 describing habit routine, asking for directions. So here and there we are mentioning about the habit for, of the people. So we need to understand the people. Here the main purpose is how we are supposed to understand the people. We know about their habits and our habits. So it is total personality, and here communication skill, and through the communication we understand other people and understand ourselves, and that is there in grade 11, the first unit. And second unit, it is talking about self management skill and strength and weakness analysis, grooming, personal hygiene, teamwork, networking skills, self motivation, goal setting, time management. Here also, and here it is mentioning about the strength and weakness. We need to know about ourselves, and we need to work on our strength. If we are very polite, and we should be very polite, and we need to concentrate on that particular skill, then we will be able to get the confidence also to deal with the patient. And then grooming, our appearance is very very important in the hospital, how we appear before the people, so that is also apt for dealing with the patients and their bystanders. So that kind of appearance we need to have, and very beautifully it is being described in session 2 in unit 2. And then personal hygiene, so we have seen one video, Piali ma'am showed you one video where personal hygiene, how to hand wash, that has been given. With that, our personal hygiene also important, people must feel that, and we are neat and tidy, and while we are touching the patient, they feel that we are, and they should not get again other bacterial or virus infection. So such a way neatness and hygiene is very important, and that is being beautifully explained in session 3. And here actually in this employability skill, actually we are talking about our appearance and our behavior. So when we think about the skills compared to other subject, like the main subject like social science or English, and there we are thinking about how can we incorporate skills. But here in healthcare, it is completely totally about the skills, and every action is talking about the skills and what is advantage of having these skills that we can improve upon. Everyone can improve upon these skills. Personal hygiene also we can improve upon, grooming also we can improve upon. Now next session 4, it is talking about the teamwork, and that is again one of the best important and very important part of teamwork, where the public must get help with our teamwork in the hospital, how we support the doctors, how we support the nurses, and how we are managing the teamwork, being in the front office, being in the this operation theater, and what kind of support we are giving. So only through teamwork and the patient will be getting cured. So the teamwork in the hospital industry, that is one of the main area we need to focus on. And next one is networking skill. So both the kind of networking, like we need to have interpersonal skill, the same way we need to know about the technology also. We need to be available anytime through technology and also through interpersonal skill. Both kind of networking, it is important, and here it is mentioning about how to use incorporate technology in hospital industry. And self motivation, so by seeing a patient or by talking to the patient, we should not get depressed, and we need to support ourselves. Self motivation is very very important in hospital industry at times, and we get tired, and we may not be able to communicate properly, and by seeing certain cases of the patients, or even by getting demotivated from the bystanders of the patients, so there we need not get depressed or need not be tired, and we always need to support ourselves. Self motivation is very important. That also has been very beautifully given in this particular chapter, goal setting. So in the morning I told you goal setting is one of the major success in everyone's life. In this hospital industry, it's not on our own success, it is actually the success of the patient and the bystanders. Here the goal setting is to help a patient to come out from the ailment and illness. So their goal setting is very important, and even the goal setting is coming as part of our work. So we need to work always goal oriented. So that beautifully given here also. And then again, time management. If we are not able to do something on time, and that is affecting the health of the patient. So how we manage the time, that's very important, very serious in hospital industry, where we will be able to help a lot of lives which is coming as ailment in the hospital. So time management is very important. How, what time we reach, what time we finish a particular work, and how we manage the data entry, how we deal with every patient. It must be time bounded. So that is very beautifully given in chapter unit 2. And again, next is unit 3. Okay, unit 3, and next one is unit 4, entrepreneurship skills, and here introduction to entrepreneurship. And here also it is helping people to become a better businessman, where we focus on service. Hospital industry, it is service oriented industry. So as an entrepreneur, how we deal with, how we are supposed to serve the society, and that again beautifully given here. And the values of an entrepreneur, it is service entrepreneurship. Even though some products and we are selling, but the product, by selling the product, it's a service to the society. So that has been highlighted over here. Attitude of an entrepreneur, and that's very very important. And attitude should not be money minded, money oriented. It should surely focusing on the service of the people, and thinking like an entrepreneur. So we always think that, and we are an entrepreneur where we are helping someone and supporting the society, and where every member in the society is getting help from our business. And then coming up with a business idea. So next again, we can have lot of ideas. Even we know that now in education, lot of business it is going on, and most of them, and surely it is supporting the education sector. Same way in hospital management also, the business, it should surely must support the patients and the hospital industry. So that kind of new ideas and people can bring out. So that kind of lot of ideas, even the children also, they can think about a new idea where we are able to support a patient, or where we are able to support a hospital. And then understanding the market. So we need to know what is the requirement of the people. Now we know that certain people, and they are keen to have vitamins. So we need to understand the need of the people, and that is actually understanding the market. Understanding the market is actually need of the people, and accordingly we are supposed to uh, take up the business. And then business planning is also very important. Planning is also very important. Then only it will be successful, then only that will help the people, especially the customers in the hospital. And the last unit in class 11, it is talking about green skills. So in the morning we have seen the green skill is completely talking about sustainable development goals. We need to nurture our nature, we need to preserve our nature. So this chapter is completely, each chapter is giving focus on sustainability or preserving the nature. without nature, without the plants and other animals, and life is impossible. So that's why this unit is talking about sectors of green economy. Which are the sectors? We focus on preserving our nature. And second chapter is talking about policies of green economy. We have seen which are the policies which are coming to preserve the nature, using only the what I say plastic, completely avoiding the plastics, and that also is not degradable things. And such policies the government has to take up, and what we are supposed to use to carry. So that is one policy actually of the government. So here in the hospital industry, what are the policies we are supposed to adopt to support the nature, or for the green economy? From the word green itself, we know that we are supposed to support the nature. Stakeholders in green economy, and who all are the stakeholders in the green economy who are completely focusing on preservation of the nature. Section 4 again, government and private agencies. What are the roles of government, and what is the private agency's role to sustain the green economy? And that also it is being described in the fourth chapter in unit 5, green skills. So this much is about employability, this employability skill. So here the word employability skill shows that as a employee, what are the skills we need to have, and where we are satisfying the needs of the customers and especially patients. So we need to see that the patients are getting cured, more than that they are getting satisfaction coming to the hospital. And such a way the employability skills, what are the skills we need to have better communication, that's very important. We need to have our own self awareness so that we can treat others as we are. And then again the entrepreneur skill, and that is also is very important, and we need to think that the business is to serve the people. And the totally I think we are completely focused on the service minded entrepreneurs. So it never should be profit oriented, and it is important that we need to get profit, but more than that it is service oriented entrepreneurs. So here the children, they may become a better entrepreneur also, and such a skill, and it is being given to the children by studying this healthcare. And again the green skills, and that is actually even in the morning I said we are focusing on sustainable development goal, not only India, the whole world. So, and this skill is important for the employee or even as a student, and where surely the children will take care of our environment. Such a way it has been described and defined in this book. It is more than I think children never think that they are learning for exams only, and beyond that it has been taking to the children. And the activities, all the activities are really interesting for the children, where they see that the school is having a particular area. In the morning Piali ma'am was talking about, we have a separate unit in our school where we adopt all these skills. And the children, as a hospital unit, the children make one room, and where the patients can be treated in a better way. So by acting in the school, and they are getting all the skills also, where the children surely enjoy learning, they never feel that, and they are actually learning. So such a way it has been described. Now in class 12, class 12 again we can see that here also there is communication skill, and self management skill, information and communication, teaching technology skill, and entrepreneur skill is also there, green skill is also there in class 12 also. Here effective communication skill, it has been given in such a way like active listening, and written communication, presentation skill, patient education, compassion, cultural awareness, personal connections, trust, verbal communication, all these has been hidden in effective communication skill. Our presentation skill, how we present ourselves, or even how we present certain information to the patients and their relatives, and that should be very effective where they are getting relief. And patient education is also important, where we need to educate the patient regarding and their curable or how we are able to cure the patient's ailment and illness, so that helping or giving relief to the patient, that is patient education. Compassion is most important. While we communicate, surely we need to communicate with empathy. Empathy and compassion, that's most important. I think those who are working in the hospital, all the staff in the hospital must have compassion and empathy, where they need to treat the patient as our own, just like and we are treating or considering ourselves. We need to understand their issues and problems. So such a way the communication skill is also very, very important. And here the self management skill, actually, uh, here we are giving more importance to thinking skill. Self management skill here, thinking skill, where we need to have interpersonal skill and problem solving. Thinking skill, we know that there is creative thinking, critical thinking, and analytical skill. So these three are important. We need to critically analyze a situation. We need to be very creative at times, and where we are able to support the hospital industry. And then we must be able to analyze the situations properly. Such a way, thinking skill is very important for self management. And more than that, problem solving ability, we must be able to solve a problem, and there we can support the people in around us. And then we need to self management, we need to think about productivity, initiative, our integrity, our confidence, our analytical skill, lifelong learning. So we always must be in that particular mode, where we need to understand the people again, where we need to learn furthermore. So that lifelong learning is a skill which we need to have as an employee in the hospital. And effective communication, resilience, honesty, flexibility. And some of the people may not be having this flexibility. So self-management, we need to see that we are flexible and we change or we adjust according to the situation, where we are able to support other people. Such a way, self-management here in this chapter, it is described a very broad way, very beautifully it has been described over here. So now again, stress relief tips. And here we have given I think some of the tips for the stress relief. So I can share the video with you, where you can see that stress being released. 1 second. So I'll be sharing this video soon.
Ma'am, can I help?
Yeah. Can you just share that PPT?
Yes, ma'am. I am opening that video, ma'am.
Okay. Tips for the stress relief.
Yes, ma'am.
Yes.
Want to zap the stress and introduce a little more zen into your life? Follow these 7 steps for a more peaceful path. 1. Eat a healthy diet. Forget the ice cream binge and load up on fresh fruits and veggies and lean protein. Your body will thank you with a happier outlook. 2. Get enough sleep. You'll be better able to handle stress that comes your way. Didn't catch enough Z's last night? Grab a nap for a mood boost. 3. Get moving. Take a stroll around the block, walk the dog, or bike to the grocery store. Find an exercise buddy. It's always more fun to exercise with a friend. Exercise releases good chemicals that will lift your spirits. 4. Try some tunes. Soothing music can lower blood pressure, heart rate, and anxiety. Upbeat tunes can help you blow off steam. 5. Come up with a stress relief toolkit. Meditate. Take a long walk. Watch a comedy. Curl up with a good book or light some candles. Find what soothes you. 6. Enjoy nature. Work in the garden, walk in the woods, or relax in the park. A change of scenery can brighten your mood. 7. Get social. Have lunch with a coworker. Phone a friend. Volunteer. Take a class. Being around other people will give you a fresh perspective and help you find your happy place. It's all about what works for you. So start letting go of the stress in your life and move to your place of peace.
Okay, thank you. Thank you. Stress relief mechanisms, and we need to see that, and we are having a lot of techniques to release the stress which we have with us. So that's very important, and that's why people at times they are doing with what I say uh, meditation and exercise, yoga. So these are some of the ways by which we can release the stress which we have. So I know the people, those who are working in the hospital industry, need to understand the importance of stress relief mechanisms. Okay, so I'll be continuing this once again by sharing my video, sorry, PPT. Okay, so we have seen that how we are able to relieve the stress within us. So next, I think the skill is information technology, information and technology skill, and that is also again and again every year children, they are studying from 9th onwards, and everywhere I think they are learning new things about technology. So here, and they are learning about information media and technological skill, core subjects and 21st century theme, and life and career skills. Okay, standard and assessment, curriculum and introduction, professional development, learning environment. So these things, and we are studying over here. So how we integrate technology to preserve the nature. So it is campaignly given in the information and technological skill, where we are focusing on what I say sustainable development goal also. And here, and they are getting an opportunity to see that, and they have career scope by learning this. So that is also been explained over here. So next is entrepreneur skill, and here, and we are studying about what I say. I'll make it full screen. So here we are talking about leadership, and then governance, culture, success stories, and for entrepreneurship, and we are studying about the best entrepreneurs who are successful in their life, and it is good for us to understand their stories. And then human capital, and again education, infrastructure. We have seen all these things even the last slide also. Network and support services, early customers. So how can we become a successful entrepreneur? So here we are studying about this one, entrepreneurial skill. Next is, we are talking about the green skills, and here we are learning bit more about the green skills, and where employment in the context of environmental transition. So what kind of job opportunities are there while we preserve our nature, climate change, adaptation and resilience, how we are supposed to live according to the changes in the climate and changes in the environment, and that has been described over here. And decent job, social inclusion, poverty reduction, environmental quality, biodiversity, and resource efficiency. And I think by studying this particular chapter, and the children, they manage how they can clean their campus, and what are the new methodology for the biodiversity. So they experiment and they become creative also. And then green skills, new and upskilling, generic and specific. So they, here, that's what I said, and here they are getting a chance to be innovative and be creative, and they can analyze the situation also. And services, minimum environmental impact, and what kind of product we can see, use where, and we can think about minimum environmental impact by using this kind of product, or by living such a way. How can we live a life where we protect the environment? And that also is being described over here. And again, next video, ma'am, Piali ma'am, can you please help me by showing that video?
Yes, ma'am. Yes,
Okay.
that video 5, no? Video 5.
Yeah. Yeah.
Hi there, my name is Ruben. And I'm here to give you an overview of skills for the green transformation, also known as green skills. I will explain what they are. But first, let's talk about why they are so important. There is a global sense of urgency in addressing the consequences of climate change. An international consensus is developing for completely rethinking the way we live and work. This paradigm shift is known as the green transformation. It has 3 dimensions: social, economic, and environmental. To implement this transformation, we need to adapt existing skills and learn new ones. As this graphic shows, there are 2 broad categories of skills, technical and transversal, and each one has 2 subcategories. Technical green skills apply to new types of jobs that are being created, such as solar panel technician or sustainable fashion designer. Technical green skills also include upgrading existing occupations, such as energy efficiency, sustainable farming, or waste recycling. The second broad category of green skills are called transversal or soft skills. Examples are communication and teamwork or problem solving. Transversal green skills also include those that will move us closer to a just society. These transformative skills include disruptive thinking, embracing diversity and inclusion, and systems thinking. As I've explained, skills for the green transformation are essential to addressing climate change. And learning these green skills can also be valuable assets in our careers. The first Global Green Skills Report from LinkedIn in 2022 shows this clearly. The share of green jobs in the workforce increased by an impressive 38% from 2015 to 2022. In the past year alone, 10% of all job postings have explicitly required at least one green skill, and the rate is increasing. The green transformation is gaining momentum. By learning and implementing the right skills, we can all contribute to making our planet greener. To find out more about skills for the green transformation as they relate to the EU Vet Toolbox, pause the video and scan this QR code with your smartphone. You'll find a lot of valuable information and insights. Goodbye, good luck, and go green.
Okay, thank you, ma'am.
Right.
So here we have seen what are the uh, ideas to bring the green skills within us, and even in our job places or even in the society. So if we try, usually if we are creative and if we are innovative, and surely we can see that, and we could live in a better environment, and where we support the nature also, even other creatures and plants around us also. So the children, surely they are getting a better idea that how can we live in the society in a better way, not for us alone and even for others. So that idea the children they are getting, and by studying about all these kind of skills, self-awareness, entrepreneurship skills, and even green skills and social skills, all these are really important for everyone, especially in the hospital industry. Why? Because in the hospital sector, actually we can see that the people are suffering because of lot of ailment and illness and the lifestyle. So we are getting motivated to live in a better way by seeing how the people and they are suffering. So just to reduce the sufferings of the people in the world, and also for our own support, and we the children they surely will be getting motivated to live in such a way by learning, I think, this employability skill. Even though the name has been given employability skill, it is actually life skills where we can improve upon. And even maybe employability skill has been given the name because everywhere in whatever area the children and or the people they work, and they surely will be able to work in a better way, and they become ethical also. In the morning, and ma'am was talking about ethical behavior of the people. So we surely will be ethical, we surely will be supportive, and we surely focus on a life where we can live with happiness and peace. So that's why this chapter is very, very important, I think. And even class 12, self-awareness, it has been given in the theory part also. It is part of the theory, one chapter, it has been part of the theory also. So this much, I think, ma'am, I have finished. I think you can just talk about the 11th portions, and after that I will be passing through these 12th portions again.
Okay.
Okay, ma'am.
Okay.
Thank you.
Now we will come back to our portion once again, subject specific skills. Subject specific skill for grade 9, 10 already we have discussed. Now we are going to discuss about grade 11 and 12. First I will discuss about the practical part, basically because in grade 11 and 12 the practical is very important along with the theory, because theoretical knowledge already our students have got in grade 9 and 10. So when they are coming to grade 11 and 12, so basically we have to focus on their practical skill, because it is a skill based subject. They have to do the hands on experiences. They should get the hands on experiences where they can get the approach, practical approach they can get. So and if any student, maybe it can happen for some time for some school that they didn't learn the subject in grade 9 and 10, for first time they are coming to grade 11 and 12, they are taking the healthcare as their skill subject, their optional subject or their main subject, whatever. So when we will implement the practical along with the theory, the students will get more interest in the subject, and the students will be means they will think that yes, these are the areas what we can implement in our daily life, what can may help us to create our career. so they will be get more motivated about the theory and practical. So theoretical part also we will discuss, but practically what we can do, the students will assume that they are working as GDA, and they will prepare the report based on the service provided by the hospital to them. That is basically unit 1, hospital management system. From the unit 1 hospital management system, this activity we can perform. In the another activity we can perform from hospital management system, the student will prepare the flashcards about the different laboratories. They are going to prepare the flashcards about the different laboratories. Suppose in the school also, when they are visiting to different laboratories, like they are the social science laboratory will be there, mathematics laboratory will be there, their chemistry lab will be there, physics lab will be there, biology lab will be there, many laboratories they are exposed to. So when they are visiting to different kinds of laboratories, so they are getting one idea. But we have to, as a teacher, we have to train our student key in the school. These laboratories and the hospital, the laboratories will be quite different, because our students are having the idea, they know laboratory means only they what they are observing in the school. But when we are talking about the healthcare subject, then the laboratories that are basically the hospital laboratories. Hospital laboratories means we can, when we will visit the hospital or nearby clinics, then they can come to know about the microbiology laboratory, biochemistry laboratory, histopathological laboratory, and where the means the study of the cell biology laboratory. So there, when they will go, they will get one overview. Yes, in microbiology laboratory, how the healthcare professionals are working, how much careful they are when they are dealing with the microorganism, when they are working in the biochemistry laboratory, so what kind of chemicals they are using, when they are working in the histopathology laboratory, then when they are dealing with the surgical tissues, surgical organs, then what they are doing with those kind of things, how to preserve the different organs and in the formalin solution. So they will come to know about all those laboratories. So we, as a teacher, we have to give the students a clear idea about all kinds of hospital laboratories. The students will draw the steps of hand washing, that in the morning time only I have shared with all of you, and that we can make the practice of hand washing technique during everyday time, so that our children can use that before the means the breakfast break or during the lunch break, so that we can also reduce the effect of different kinds of disease causing microorganism in our own school. It will be really beneficial if we can make the awareness in our school, and just to practice the hand washing technique on the everyday basis when our children are going to take their food. So that will really be helpful. And after using the washroom also, after using the restroom or washroom, they can also use the hand washing technique, so that many kinds of germs we can get rid of. And when we will practice this kind of hygiene, personal grooming and hygiene technique in our daily life. The students will prepare the chart for the activities and demonstrating about the grooming habits. And then, as a receptionist, when they will be working as the receptionist, that is the part of the unit 2, you can see, that is the role and duty, role of the duty, general duty assistant for the outpatient care. Basically outpatient care means when the patient is going, visiting, consulting the doctor and coming back home, they are not taking any admission in the hospital, that is called the outpatient care. So we have to train our students in a way कि when they will be working as the outpatient care in any hospital, they have to maintain their patient level, they have to understand the advantages and limitation what a receptionist job they are having. The student will prepare the catalog. What catalog they can prepare? Various types of thermometer and blood pressure apparatus and identify their function. The students will measure the vital signs already in grade 9 and 10. The students have already done that. If the students are already, they have habituated to do this in grade 9 and 10, so grade 11 for the teachers it will be quite easy for you to train the students because they know it. But few students as a teacher you can get in grade 11 and 12 when they are coming for first time in the healthcare subject. So you have to train you. Grade 11 teachers also have to be ready with all kinds of list and materials with in the laboratory of the healthcare. You should also have the blood pressure machine. You should also know how to measure the pulse rate. You should train your students how to measure the respiration rate. You should as a teacher we can train our students how to measure the temperature and breathing rate, everything. The volunteers in the school also we can call them and we can tell our students to practice on them, so that it will be a real life experience for our students to get the exposure in the healthcare field. The students will measure the height, weight, and BMI. Already we have done it in grade 9 and 10 also. But if any student has come for the first time, so grade 11 also we have kept it, because our motive is when one student will take either 4 years complete course of healthcare or grade 11 and 12 2 years course, nothing should be the think it is like that is the student has missed anything. Even though in 9 10 if the students didn't get the chance to do any practical, so that practical in the another way we are keeping it in the grade 11 practical also, so that every student whenever they will pass grade 12 with the healthcare subject, every student should be equipped with all kinds of knowledge that is related to our healthcare field. Next one, the students will transport the volunteers as patient from one place to another place. That's very important. If possible, grade 11, we can, we in our school laboratory, we can keep one very simple stretcher like thing, so that our students can know how to transport the patient. Suppose sometime it can happen, any teacher, any patient can be very much get very much sickness or very much ill in the classroom only, the patient is not able to move or something happened like that then and there the person has to get out from that place and taken to a safe place where the person will feel somehow comfortable, because this is the human life, anytime anything can happen. So we can train our students in the 11 12 grade basically, so that those students can be helpful to deal with any kind of emergency situation. If it is coming in the school, if it is coming in their house, if it is coming in their neighborhood or in the society, anytime anywhere they will face any kind of situation where they need where the people need the medical emergency help, but it is not available. We can make the student in a way, we can train the student in a way they can provide that initial medical help to our society. The student will prepare the practice to fill the patient admission form. It is there in medical documentation part. Basically theoretically when they will learn, they can make one admission form, so that admission form we can use in our school sick room also. When one patient is coming, and as a teacher or as a student, if any patient is coming to our sick room, so that student or that patient has to fill, or anyhow maybe the student or that the teacher will not be able to fill it on that time specifically, but after that, that is just a habit of preparing one admission form, fill up one admission form, so that as a school also we can keep the record in a day how many patient has come to our sick room and got the treatment from our sick room. So that, and through that admission form we can come to know about if the person is suffering from any other kinds of problem or not, what are the different symptoms. If that patient is really facing any serious problem, when from the school side we are taking that person to hospital, so that admission form, that is very non formal admission form what our students have created, maybe that can be life saving also. That admission form can be given to the doctor for the treatment ki when the person was not feeling well for first time, so what were the different symptoms the patient was feeling. So if we can tell those things to the, because when we are going to doctor maybe we are not able to tell everything, through that admission form doctor can come to know and the treatment procedure can be more better. As a GDA, the student will prepare the daily care plan for the infant and elderly. Already we have discussed on that, how the care plan our 9-10 students can prepare. Only some modified way or in specialized way. As a teacher, we can help our students to create that. The student will practice the bed making, that is the occupied bed also it can be, or non-occupied bed also it can be. So by the use of any kind of dummy or the volunteers, basically we can in the comfortable style we can help the students or we can train the student to make the bed for the patients. Now the next one, the students will find out the steps taken by the administration to provide the first aid in case of any emergency in school. In any emergency happen, how the administrative people will be involved. So the students will only play the role as the administrative people, and they will only guide the patient or guide the people to go to the specific area, to go to the hospital, and they will be helping in creating the rapport in between the emergency situation and the doctor, so that the doctors will get all each and every information related to the emergency situation. We can train our students in that way. So the students will use their own first aid kit with all kind of equipment, but in the morning session only I already informed all the teachers, please be mindful and please just keep a look on each and every student's first aid box. No student should carry any kind of medicine which is not applicable to use. Now, no student should carry any specific type of chemical that is not acceptable to be used in the school. The student should not carry any sharp object in their my first aid box. The teacher should be very careful about what the students are keeping in their first aid box. And the every weekly or monthly, not monthly, because monthly will be very late. The students can change their things also. So each and every teacher has to be very mindful and please keep a look on the first aid box of the students. The student will practice the cardiopulmonary resuscitation procedure on the dummies, the CPR. 9-10 students also have done, but if they didn't get the chance, now some teacher you can ask me that when already in 9-10 the students have done this, what is the need of 11-12? Yes, they in grade 9 and 10 already they have done this practical, but when they will do and practice the same practical for continuous long 4 years, so when they will pass the grade 12 with the healthcare subject, they will really be well equipped and well trained professional, and they will be, when they will go to the hospital, then really the people will think, yes, where they have learned the subject, they have the theoretical knowledge, practical knowledge, and means that is our main plan for CBSE, to train the student in a way so that we can give means this kind of manpower for our country, so that it will be really helpful for our healthcare sector. The student can decorate the board also for the World Day Safety and Health Work. The student can prepare the report about the patient care environment safety measure in the medical room. And lastly, the student can be preparing the chart for promoting the safe work environment in the school. So these are the different 18 practicals in grade 11. The students have to write it down in their specific practical notebook. Okay, at the end of the year, when the final exam will be done, then the teacher has to see the students have done all the practicals and they are able to give the answer if any question will be asked from this practical, or the students will be able to write also. Okay, whatever they have done for the whole year, everything should be written as a handbook for them. They should know, they should carry their handbook. If they face any challenge, just they can refer to the handbook and they can get the idea. Now grade 12, whatever the practicals our students will be doing, they will prepare the chart of different entries of patient. They can prepare and maintain the medical record of the sick students coming to the medical room. They can prepare the medical room for sick students. They can decorate the board about the elderly care or children care, just to create the awareness about the myths and facts of the elderly people. Whenever we are dealing with in the elderly people, we have the common myth that the elderly people are very weak. They can't walk properly, they can't eat properly, they can't hear properly, they can't smell properly. But it is completely the myth. In our country, in all over world, we will get many elderly people who are so much active, and they are so much active that we should learn from them. As a young generation, we should learn from them many things, how to be active. The young generation should learn from the elderly people also, that how to be active. Many examples we are having. So whatever myths and facts our young generations are having, as a teacher, when we teach our students, we have to educate them ki elderly people doesn't mean ki they are very weak, and I mean they can't do anything. That is completely a myth. Elderly people, we have to respect them. We have to get the lesson from them, because they are more experienced. So that myth and fact, as a teacher, we have to break, and we have to create the awareness among our students that we can get the help from the elderly people, and how we can give the support to the elderly people so that they can do more better. Next one, grade 12 students, they will be arranging the seminar also, discussing about the taking care of the elderly people, because in the school, when we are dealing with our students, many of our students are having grandparents at their home. So it is very easy that when they will deal with the grandparents at home, so they will come to know the what is the comfort situation for the elderly people, and they will get the clear idea about how to take care of the elderly people. Measuring the vital sign, already in grade 9 10 we have done that. In grade 11 12 also, 11 and 12 both, we as a practice continuous 4 years, we as a teacher, we have to continue the process to educate our students. And decorating the board about the basic needs of the adolescent, already when our students grade 11 12 students, they are already in the adolescent stage. They are only dealing with many problems in of the adolescent stage. So as a teacher, we have to take the hold so that we can educate our students to control their self. What Manoranjani ma'am was telling just now, self management, stress management. Ma'am has shown you the 7 steps how to relieve the stress in the life. So when our students are only facing the adolescent stress or the problems of adolescent stage, as a teacher, we can train them how to control our inner mind, how to control our means how to do the self control, or like how to manage the stress level, how to do the time management. So everything we can train our students to create the awareness. Now prepare the chart to explain the roles of different hospital staff and in management of the hospital waste. So that same practice we can do in our school sick room also. Next one, the presentation and the views about the duties of the staff of operation theatre. It will be really very difficult to create any kind of operation theatre, means creating it in the school, it is not at all a possible thing. So what we can do, we can show the video to the students related to the different operation theatre setup. We can show them the picture related to the operation theatre setup, and I don't think when we will visit to any hospital, they will not allow us or our students to go inside the operation theater to and look around there, because operation theater is the place that is completely sterile in nature. So that basically with the specific dress material and specific attire only, the doctors can enter inside the, or healthcare provider can enter inside the operation theater. So as a student, when we will be visiting, or we as a teacher, when we will take our students to any hospital, when they will be talking to the specific doctors who are doing the surgeries. So the students tell our patient, means students, that they can talk to the doctor, they can ask the doctor what kind of operation what kind of actions are basically taken care in the operation theater, how the sterile control management is done in the operation theater. So by interviewing the doctors, our students can get the idea about the operation theater. Preparation of the diet chart for the patient for post-operative care, preparation of chart to explain about the role and responsibilities of the emergency response team during the disaster management, and decoration of the board about the benefit of the drills. Drills is very important in emergency situation. In many schools we follow the drills. If earthquake happens, if any time fire happens, so how to perform the drills, in which way we should evacuate our school building, so that way we can practice the drill among our students and in our school also, so that our students, healthcare students, can make the awareness in the whole school and they can help to evacuate the building during the drill process. So it is also very important. Next one, preparation of the time logbook or to-do list that will maintain to evaluate at the end of the week. As a teacher, we have to take care of this, because in the adolescent stage, when the children or the students will be trained up to do the time management, to follow the to-do list, and after the completion of the work, if we motivate our student by giving them some time, some intrinsic or extra, means some extrinsic motivation also, like it will be really beneficial. When we give some extrinsic motivation from our side to the students will get some intrinsic motivation from themselves. And from grade 11 and grade 12, if we practice the same to-do list, same time management, and if we make them practice it in their life also, so it will not only be beneficial for their future careeristic goal, it will be really beneficial for our students to get to get very much what we can say, they can take their action in time, or they can complete their work in time, and means any kind of situation, any kind of challenge they can manage very easily. Now the next one, recollecting the problem that is faced and solving them in the confidential way. Confidentiality, maintaining the confidentiality. So this is very important. Grade 9, 10, actually this confidentiality was not imposed, because grade 9, 10 their age group is less. But when they are coming to grade 11, 12, they are almost at the age of 17, 18. By the time, as a teacher, we can train our student to maintain confidentiality, because when they will be working in the hospital, maintaining confidentiality is very important, because any patient is suffering from any disease, that is the confidential matter for the patient. We should not disclose that to anyone, any other person. So how to maintain the confidentiality, how to maintain the confidential report, as a teacher we can train our students. So we have completed the whole thing of the curriculum part of the grade 9, 10, 11 and 12. Now the last part I am telling you how to reach up to the healthcare. When as a teacher, many teachers may have the doubt that from where we can get all the documents. So basically I want to show you. First you can you have to search for CBSE website. When we are searching for CBSE website, here you can get the academic website. When in the academic website we will enter, there we can get the skill education. In the skill education, if we enter, we will get all the information related to our healthcare subject. Curriculum will also be available, books will also be available, sample question paper is available, old question papers are available, everything, every data related to the skill subject, related to healthcare subject, everything is available in our CBSE website. Now the next one, the question paper design, that is very very important. Blueprint, these are the blueprint of question paper design who are dealing with grade 9. So the 9 and 10, those teachers can give some look in this. This is grade 9 and grade 10 question paper design. This is grade 9, you can see class 9 and class 10. This is the sample paper. It was from the basically the sample paper, and when the board question paper is made, basically the same blueprint or some different blueprint also it can be followed up, but we can say that basically means the board question paper will also be followed more or less on the sample paper. Okay, so sample paper is very authentic thing that we can go forward just to make the question paper design. So as a teacher, when we are making the question paper, so they are from how many 1 mark question we have to prepare, how many 2 marks question we have to prepare, here everything is mentioned nicely. So before, it is my request, whenever as a teacher you are preparing you are preparing the question paper for your students, please go through the blueprint and we make the question paper based on the blueprint only. Because here if you see all the chapters, subject specific skill, healthcare delivery system, total question 7. In all concept we are giving 7 questions. Total questions are coming as 35, where the student has to answer 27 question, and employability skill will have the 10 marks. So 10 mark and 40 mark, it will be total 50 marks paper. Here also it is almost same for 40 marks and 10 marks 50 marks paper. This is for class 10 board exam. So if you are preparing your students for board exam, it is the request, please go through the blueprint and may try to make the question paper on the same way it is made by the CBSE sample paper. Now grade 11 12 also on the same way it is done, but the only one change is there in grade 11 12. It is 50 marks and 10 marks paper. 50 marks are the subject specific skill. In the morning session also we have discussed on that, and employability skill is always 10 marks. So here also you can see that each and every concepts have got the equal advantages. Each and every concept, grade 11 12 grade 9 10, it is not like that ki only one concept we will emphasize more, other concept we will leave. No, whatever is given in the syllabus of the healthcare 9 to 12, we are going to follow. As a teacher, we will be making the question paper completely based on the blueprint. If it is term 1 exam, only some part you have completed, then you can make how much part you have completed, but please make the equal distribution so that the students will learn each and every topic nicely, and they will be able to give the answer from each and every topic in a proper way. So this is basically about the question paper design. So it is the health that is the real wealth and not the piece of gold and silver. So by this way we are going to finish up our first portion of grade 9 to 12 curriculum discussion. Now one more theory discussion is also there. I will share that with you all. That is the grade 11 portion, only the theoretical portion. Some Manoranjani ma'am, only a small portion is left, that is the theory portion of grade 11. I will complete and then I will give it over to you. You will discuss about grade 12 portion, ma'am. Okay, ma'am?
Okay.
Okay, ma'am. Okay. So this is the grade 11. Already the practical part we have discussed on this portion. This is grade 11 hospital management. What are the different theoretical portion our students have to learn? They will basically assume them as the GDA. They will prepare the report based on the services provided in the hospital by them. So this is basically the theoretical portion. The students will prepare the flashcard of different laboratories, and you can implement these activities when you will be teaching the theory portion. As a teacher, only theory portion if we teach, the students will not get the interest in the theory. So every time we have to implement some activity or some practical in the theory, so that we can create the motivation, or we can create some interest among the students. The students will prepare the chart by demonstrating the grooming habits. The students will draw the steps of hand washing. Already we have discussed everything. Hand washing techniques also we have seen in our previous session. And general duty assistant, they will perform in the medical room. When they will go, what are the different activities of the receptionist, they will discuss on that. They will prepare the catalog of various type of thermometer. They will measure the vital sign. These are also the activities and practicals they can perform in the hospital. So here I want to show you one video related to how the BMI can be measured. This is actually the basic role of the general duty assistant.
Being overweight can lead to many health problems. It increases the risk of heart disease, diabetes, high blood pressure, joint pains, arthritis, depression, and certain cancers. Is your weight right for you? Here are 2 ways to check it yourself. First is a BMI, or body mass index. It gives us an idea of how well matched our weight is to our height. It is calculated as a weight in kilograms divided by height in meters squared. Now let's make that easy. Check your weight in kilograms and check your height in meters. Remember, 1 meter is equal to 100 centimeters. So it's easy to convert your height from centimeters to meters. Now divide your weight by height once, and then divide it by height a second time. This is your BMI. A BMI between 18.5 and 25 is considered ideal. Over 25 is considered overweight, and over 30 is considered obese. However, BMI is by no means perfect and does not tell the whole story. It's not only about how much weight, the distribution of weight also matters. Some athletes may have more muscle weight, and that's okay. It's weight due to extra fat stores, and more specifically central fat, that is more problematic. Weight-related health problems are more common in men who have a waist circumference over 40 inches and in women who have waist circumference over 35 inches. Watch our next video to learn tips on improving your weight and weight distribution.
So these are the different roles. Means as a students, we as a teacher, we have to train our students to measure the BMI also, because the obesity can create lots of problem in our daily life in future. So that's why we have to, in the practical, definitely we have to implement the measurement of the BMI. Now these are the different, just now I was telling about that stretcher and everything. We can keep it in our school also, in the small, not like this kind of modified version, but something like wheel or something where we can transport the patient from one person to one place to another place. So the student will transport the volunteers or patient from one place to another place also, when like that is the farless stretcher, trolley braid, anything, any wheelchair, something we can maintain there. And the student will prepare or practice or fill the patient admission form also, that already we have discussed. They will prepare the daily care plan. They will practice the bed making process in the hospital, and occupied bed making process already we have seen in our first session. They will find out the steps to take the administration to provide the first aid in the emergency school, and they can use their own first aid kit also on the dummy, or they can practice the CPR on the dummy. So
hello.
So now I want to share another video with you, just to show up how the CPR process is done in the dummy.
Hello. In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site, called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC, and if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally. Why not take a training course to practice these steps? Share this video with friends and family to make sure we all know what to do.
So this is the way we have seen that how the doctor ABC, it is important in our life, and we have to train our students in the way that any time in their life they can follow these doctor's ABCD. That is the danger. They have to find out the danger. They have to respond to the danger. If it is out of their control, they have to shout for help. Then if the person is breathing, or otherwise the person is not breathing properly for 10 seconds, it is shown, or otherwise breathing is happening very noisy way, so then we can start with the CPR. So airway breathing circulation can be done, and defibrillation also can be done. So this is the practical we can include in our grade 11 12, especially in the curriculum. Maintaining the safe and secure healthy environment, the students have to create the awareness on that, and they can prepare the report about the patient care environment safety measure in the medical room also. The student will present their views by preparing the chart on promoting the safe working environment in the school, because school environment is the most safe place for all of us, teachers and students, all of us. School is the most safe place. Whenever as a teacher also we go to school, or whenever we are as a parent we are sending our children to school, or whenever the children are coming to school, all are thinking like that, we are going to the most safe place of the world. how much safe our home is, our school is also that much safe place. So that attitude among all of us, we have to maintain that. And if any person is not feeling safe, so we have to create the awareness among them, just to make it sure, yes, your home and school, these two are the safest place of the world. So through our healthcare students, we can promote that. And now grade 12 portion, ma'am will Manoranjani ma'am will take care of grade 12 portion, curriculum portion.
Okay, okay, ma'am. So will you be presenting or uh, hello, ma'am? Can you please on your audio?
Sorry. Ma'am, if you want to present, you can present also, no problem. Otherwise, I can present from here also, no problem.
Yeah, this particular I think PPT, and please present it, and because the same only.
Okay.
Okay, next slide, ma'am.
Going. Please 1 minute.
Okay. Okay, so we are continuing with the class 12 portion. Actually, here we are giving 5 C's in medical record documents. So, first chapter is talking about medical record documents. So, which are the 5 C's, which is very important, that is clarity, conscientiousness, and completeness, confidentiality, and chronological order. So, these are the 5 C's, and which are very important while we are managing the medical documents. So we need to see that, and we are very careful while we are recording, while we are keeping the medical records. So this will help us to see that, and we are keeping it in an orderly way, or a very judicial way. Next slide, ma'am. Okay, so role of GDA in elderly care, that is the second chapter. Here, I think by learning this particular chapter, nowadays we all know that we keep elderly people in old age home or somewhere, because we are all working and we don't have time to take care of our parents. But this particular lesson surely will give the children an insight that it is our duty to take care of our parents, elderly people. So here, introduction to care of elderly. How can we care for elderly people? Age related changes in people, and what are the changes which is happening age related, like menopause for the ladies, and then how can we treat them? All these things are very clearly explained over here. After 60 and after 70, and the people may change physically and even mentally also. So how can we take care of them with the changes? So this very clearly explained over here. Basic needs of elderly people, that's very important. And we may not be able to understand the needs of the people, elderly people. So I think this particular chapter again giving an insight to see that elderly people, they have a different need than the youngsters. So, and even at home we can take care of our parents. How we are taking care of elderly people in the hospital, the same way we can take care of them at home also. Taking care of common problems in elderly people. Which are the common problems in elderly people? That also very beautifully described in this particular chapter. So this is, I think this is really an insight to the taking care of the elderly people. And I hope by studying, after studying this, the children, they never keep their parents in the old age homes. So this chapter is very important. Ma'am, can you please change the slide? Okay, so role of GDA in child care. So next, elderly people we have seen. So next chapter is talking about how to take care of children. Child caring for infants and children. Inside that, how can we take care of the children at home also? So after the delivery, how we are taking care of the children, and that has been given over here. Even the children, those who are coming with a lot of ailments and illness, how can we treat them? And that has been very beautifully explained in this particular chapter. Ma'am, next chapter it is talking about biomedical waste management. So this is also very beautifully given, and segregation of biomedical waste in color coded bags. So you can see that yellow color, infectious waste, bandages, cotton, body parts, etc. So here from this, and we understand that hospital, how they are taking care of different kinds of waste in the hospital. So they are not dumping everything in a particular waste, and they segregate it based on the intensity of the virus or bacteria, or the what kind of waste it is. So red color here it is given, infected dressing, POP, cast, etc. Blue, gloves, syringes and plastic waste. And in black, citroxic drugs and chemical waste. And in white, needles and cut glasses. Such a way, and they have given in most of the, all the hospital, not most, all the hospital, they have given the idea like how we can segregate the waste, and it is how easily we can manage it. So this is very important understanding for the children. Even at home also we are segregating the plastic and even the food waste, but hospital they have different kinds of waste and how they arrange it. And this has very beautifully given. The children truly enjoy by learning this particular chapter, I believe. Next slide, ma'am. Operation theater, and already Piali ma'am said that Operation theater we may not be able to get inside as an ordinary person, so a lot of precautions are needed in the operation theater. So but in the slides and in the videos, the children they can understand uh, how important it is that we need to take care of the patient and even the whole place, whole area of the theater, zone and area in operation theater complex. So very beautifully, and they are maintaining it. Organization of operation theater, before an operation they need to organize the theater very properly, judicially. And then preparation of patient for operation, post operation care, this much is given in that particular chapter, where children understand that. And it is very important that we need to find that operation theater is a very important area where the people are getting their life back. So such a way it is beautifully explained over here. Even in the post operation ward, what are the precautions we need to take before the operation and even after the operation, very beautifully explained in this particular chapter. Next, ma'am. Okay. Role of GDA in disaster management and emergency responses. We know that the children will be getting the job as a GDA. So, what is the role of GDA, and especially emergency management and also disaster management? Even though we study disaster management in the school, but in the hospital, disaster management is very, very important, and it is an emergency situation also. Role and responsibility of the emergency response team, so that also been taught them earlier. What are their role, what are their responsibilities when an emergency happens, when a disaster happens? Response team fighting fire. So firefighting team is also there in the hospital. So each member in the team must be very, very careful while they act, while there is an emergency situation. So even through videos and all, and children they can watch it, and they can have a demo also in the school while they learn this particular chapter. Even they understand how important safety measures are very important in our life, not only in hospital, in school, even at home, everywhere. So the person must be responsible after learning this. Ma'am, next. Okay, so the last chapter is self-management and career scope. So that is actually, that's what I told while we are learning about employability skill. I told you that there is one chapter, self-awareness in life and self-management and career scope. It is a separate chapter in the theory part. Here, goal setting strategies. So they need to write the question answers based on the and self-management, time management, critical thinking, how it is important they understand by studying it as a theory also. I think, ma'am, next. Are you there? Okay, now employability skill. And just before finishing it, I can show you something else like, okay, ma'am. Thank you. So I'll just show you one thing like the syllabus. You can just see the syllabus. Okay, here this is class 11 and 12. Ma'am already have shown you. I think here you will be getting better idea like employability skill marks, each chapter, how the marks being given. Number of hours, 13 hours for theory and practical, and maximum mark for theory. Chapter unit 1 it is 2, unit 2 it is 2 and 7 hours. And again unit 3 13 hours, ICT skill it is 13 hours and 2 mark, and entrepreneurial skill it is actually again it is 7 hours and 2 marks, and total 50 hours and 10 mark for the employability skill. And again subject special skills. Here you can see medical record and document 10 hours, 5 mark. Role of general duty assistant and elderly care, it is 30 hours and 10 mark. And bio-waste management 20 hours and 10 mark. Operation theatre, it is 20 hours and 5 mark. So based on the mark and based on the hours, and you can see that what is the importance. So and you can check how much mark it is there, accordingly you can give support to the children. And unit 5 it is 20 hours and 10 mark. Unit 8 self management and career scope, it is 20 mark and 20 hours and 10 mark, total 120 20 hours and 50 marks. So this is practical. Again it is given practical, it is out of 40, and project it is 10 mark, viva it is 5, and practical file it is 15 mark. And then again demonstration of skill competency via lab activity, it is 10 mark, total 40 mark, 90 hours for practical. So total out of 100 for theory, employability skill, and again practical. So this is the thing which is there in the curriculum, which you will be getting from the CBSE site, which ma'am already have shown you. So now I can show you one more slide. I can show you the content of the textbook. It is medical record. You can see that how it is coming, practical medical record and principles of documents, content of medical documents, maintenance. So this shows the content of the theory book. It is again it is available in the CBSE site. Operation theatre unit 4 and unit 5 role of general duty assistant in disaster management, unit 5 self management and career scope. These are the chapters. So this also you will be getting from the CBSE site. So this is also important. Now I think you must be able to see that health care subject, and which is one of the very important subject and very important skill subject. So part of this, I think 6th onwards we have uh, books. Actually it is part of the healthcare subject, herbal heritage. So 6th, I think there is a separate book, herbal heritage, 7th and 8th also. So the children, they will enjoy, and even the green skills surely will be there for from with the children when they start studying about the heritage plants, and they are studying about heritage plants here there 6th onwards we are starting it. and surely the children will enjoy this particular subject, and they have theory and practical, and theory is also, sorry, practical is also there, where they can the score mark, and then more than that, and they will be responsible employee in the hospital, and they will be a responsible individual also in the society by studying this particular subject. It is one of the very beautiful subject, and other details I think you will be getting from the CBSE site regarding this particular subject. And it is good if you have a hospital, and with their support you can visit the hospital, but you can have a room in your school itself with the support of the nurses and with the support of the teachers over there, and there they are getting the practical knowledge. And more than that, any accident comes in the school, any medical emergency it is there, and half of it you can manage in the school itself. So that is one of the advantage by studying this healthcare subject. It is having more of practical side than pure or mere memorization. More than that, even in the morning itself, I told you that the children, they will be getting a job even after class 12. They get a job and they can continue their degree and even the PG also. And degree and PG is available in the subject healthcare again. It is available in India, I think. And we nowadays we know many people are having ailment and illness, so this subject is having very important role nowadays, and where the children they can study well. I feel that at times by going through the subject, I feel that it must be an important subject in the curriculum, in our education system. So such a way it's a very good subject, and where the children they will enjoy, the teachers also they enjoy while teaching this particular subject. I think Piali ma'am, it's we completed it. Anything more?
Yes, ma'am. Whatever just now what you have included, that one, that herbal heritage, it is really the means basic part of the healthcare subject. Actually, means grade 6 onwards only, means the students can get the opportunity to learn this. So I just want to share the books, actually how it look like. Already I have it, so I have just want to show it once.
Yeah.
This is the book for grade 6, actually. So, and this is the curriculum for grade 6 that is given by CBSE. So these are the index. In grade 6, the students will come to know about like the lemongrass and this the mint, how these can be helpful. So basically this is the prevention part. Means grade 6, 7, 8, basically here means we are teaching ki how to prevent the disease. And 9, 10 we are starting with that if the disease happened, then how to deal with that. So this is the main part of grade 6. Then grade 7 also I want to show one more time. Grade 7. Grade 7 basically we are talking about. Grade 7 we are talking about this part, the curriculum part, that is the
Aloe
aloe
vera.
vera.
The plant is
Aloe vera.
aloe vera. Yeah.
Aloe vera and tulsi also. Aloe vera and tulsi,
Yeah.
how we can use it in our daily life. And grade 8 basically we are talking about. Grade 8 we will be talking about this one. Grade 8 basically in the curriculum part it is given about the turmeric and the ginger, these two. So grade 6, 7, 8 basically the students will come to know tulsi, aloe vera, ginger, then turmeric, how these they are having the different antibiotic role or antiparasitic role, how it can be helpful in our daily life. And in grade 11, 9, 10 we are basically dealing with how in the healthcare field the children can or the students can explore themselves. And 11, 12 basically the theoretical and practical knowledge we are discussing about. So it is a full course, actually. So if all the schools will take the course, I think it will be really beneficial for the students and teacher both, not only for the school, it will beneficial for our society, and at the end for our whole country. Will be get beneficially from that. Yes, ma'am.
I think any questions, any queries? Jyoti ma'am is here.
I'm here.
Yeah, ma'am. We just completed and we are waiting for some questions and some queries, ma'am.
Sure, ma'am. Let me check. Ma'am, one of the teacher is asking about where they can get the sample question paper.
Ma'am,
On
it's
our
there.
website, it is available.
Yes, ma'am. In the website only it is available, and I have shown the path also how to go up to the sample paper. Means in the video only I have discussed about that how to go up to the sample paper. Means how we can reach there. And every year sample paper is already available there.
Yes,
They
ma'am.
completely depend on the site, skill education. For question sample paper and even the textbook, all
Curriculum.
other information, curriculum.
And another question is also related to this question, that where are these textbooks available? So all the material, curriculum, textbooks, sample question paper of previous years, all the things are available on our website.
Yes, ma'am.
You can
Everything is
do
there.
it simply Google,
Hmm.
and you can reach there. If you are not aware how to reach there, you can do simply Google it. You can reach there by doing Google for this.
When PRE ma'am showed how to reach from the CBSE site.
You just all the participants, if you just simply write in the search box CBSE skill education, then you will get so many options, and for the topmost option, quite sure it is this our link, and you can surf there and you can find so many things over there, like curriculum, textbook, previous year question papers, even 6th, 7th, 8th, how many subjects are we are running, you can find all the information there. One of the teacher has asked that can biology laboratory be used for taking the practical
Yes, ma'am.
classes?
Definitely, the biology laboratory can be used because in the biology laboratory we are having the microscopes and many disease-causing organism. For grade 11, 12 biology, we are showing to our patients. So, if the biology laboratory, like we can some modify something. We can modify in the biology laboratory. We can use the things from the biology laboratory also, but some modification is needed for this subject.
Many of the teachers are curious to know that whether we are going to do something about for class 6th, 7th and 8th. Like we are having a few subjects there, what to do when doctor is not around, and COVID related subject is also there. So very soon we will do a workshop, offline or online maybe, with our eminent resource person.
It is good to have a separate room where and they can make it as a sick room. So with all the arrangements, including the documents, that also I think we already discussed regarding that the schools. And even 6, 7, and 8, herbal heritage, it's wonderful textbook and wonderful subject, and it is good if you are taking that. So I made it compulsory for all the children. So such a way it is wonderful subject, herbal heritage.
Ah, okay. So as of now, I think we have answered all the questions which I got on the live chat platform. So thank you so much, Pyali ma'am and Maranjini ma'am. It was quite an energetic, very much from Pyali ma'am's side, and Maranjini ma'am, your experience is too loud and sound, and there is no comparison. And there is no comparison for the enthusiasm of Pyali ma'am. She was having a same pitch throughout the morning.
Really, ma'am. I am really sorry. I was having some problem. It is raining very heavily over here. So I was having problem here for with the electricity and other things.
Yes, ma'am,
Connectivity
not an
also.
issue.
Yeah.
You are not supposed to say sorry.
Yeah, yeah.
We do understand that there could be arise any technical glitches, and we are unable to resolve it somehow. But it was indeed a great informative session,
Yes.
and hope
Anyways, we need to really appreciate Piali ma'am, as ma'am said, and from morning to evening, the same energy level maintained.
yes.
Wonderful, ma'am.
The subject is like that from the initial stage I am with the subject, no ma'am. So it's like that ki whenever I got the opportunity to talk about the subject, I feel very nostalgic. That's the thing actually. And
Yes,
I
ma'am.
really love this subject very much, and it's really means whenever
Yes,
our students have gone out after learning this subject, they are means well established right now, and they when they contact me, really as a teacher I feel so much proud that after learning the subject our students have really got a good opportunity in many different ways in the hospital fields. They are actually means well established right now. Many of our students, they are already there.
really, it's a very wonderful subject, I think, and they are getting knowledge and they are getting how to live a life. So, life skills and values, both they are getting. So, we need not try, separately for, inculcating skill and values. With the subject, it is embedded, it seems. A wonderful subject, really.
So
Yes,
in the
thank you so
end, yes, yes,
Thank you so much, ma'am, for the opportunity being here with you. Even
yes,
though
ma'am.
it
Of
was
course, on the relapse to both of you on the relapse relying, and that's why we are conducting this workshop.
Thank
It's
you so
all
much.
your support. Without your support, it is quite impossible to conduct these kind of workshops without resource persons, without teachers' support. Because if teachers exist, that's why we do exist. If student exists, that's why teachers exist.
Yes, ma'am. Correct. And means moreover, ma'am, you all are doing so much great thing. That is really it is so much helpful for our not only teacher student for our country. You are thinking the for our future generation, and we are only preparing them. If you don't implement the subject, so how can as a teacher we can implement, ma'am? How can we prepare the student? How our India will be means coming on the better way. So every hats off to you that you
yes,
are doing that.
we
Thank
need to
you, ma'am.
appreciate skill education for bringing such a wonderful subject, even starting from 6th standard to 12th standard, ma'am. Really wonderful. We really need to appreciate skill education for this.
And we together need to promote this subject to motivate the student to opt this subject so that in the service of mankind and towards their career also it is helpful.
Yes, ma'am.
Yes, ma'am.
So in the end, with the motivation, with the thanks, I just wanted to appeal all the teachers, kindly motivate your students to go for this subject because it is not only related to career, it is also related to the peace of our mindset.
Yes,
Yes, ma'am. True. Very true.
Yes. So thank you, Pyali ma'am. Thank you, Manoranjani ma'am. And thank you, CBSE, for providing me this platform so that we all are together working towards this high set goal.
Thank you. Yes, ma'am. Thank you.
Thank you so
Thank you so
much.
much.
Thank you.
Thank you.
Thank you so much.
Thank you.
Shall we leave?
Yes, ma'am.
Okay. Thank you, ma'am. Thank you so much.